believe I'll say that. Yeah. Tell him we always knew he wanted to get in the red suit.
I'm waiting on Tracy.
Asking if you're ready.
Oh. Tracy. Can we go?
Punch in.
Get over it, Tracy.
Okay, I'll call to order the December 21st, 2020 meeting of the Haywood County Board of Commissioners.
Did you sign in? Did you sign in for public comment?
Better sign in.
I've got a special request. Oh, goodness. I've got a special proxy to be here for James Weaver Kirkpatrick III. He asked me to be here. Carry on, my good man.
Okay. Appreciate Santa Claus coming down from the North Pole.
Hey, we finally got you in red, didn't we?
I don't know what you're talking about, Brandon.
Okay.
He looks good in red, don't he?
He looks real good in red. I like the way he said my name.
He votes with us all the time anyway.
Okay, so I don't think we can live that one down, Kirk. That's pretty good. Okay, the first order of business will be our Pledge of Allegiance, and after that, our chaplain, Pastor Frazier, I spoke with him earlier this evening. He felt like it would be better for him to stay home because he's been around quite a few people this weekend with COVID being like it is right now in our community. And so we both agreed that that would be fine. So after our Pledge of Allegiance, I'll just ask for a moment of silence, and then we'll start the rest of our portion of our meeting. So if everyone would please rise for the pledge. Thank you. Okay, our next order of business are our public hearings, and we have none tonight. Our next order of business after that is our public comment sessions. Citizens can sign up, I have some that have signed up tonight, and you have, please limit your comments to 3 minutes. And audience members may not address the board at any time during deliberations unless recognized by the chair. So if you would, there's some wipes up there if you'd like to wipe the microphone with the podium. So our first speaker will be Mary, is it Piazza, I'm sorry. Come on forward, Mary. Welcome tonight, appreciate you coming.
Good evening, and thank you for your service here. Thank you for allowing me to speak. I am a constituent of Haywood County, and I'm grateful to live here. Tonight I want to share some facts. We're all affected by this virus globally, nationally, but really it comes down to where we live and what's going to happen here in Haywood County. What is COVID-19? There's empirical evidence proving that COVID-19 is not a normal virus, but rather a manufactured bioweapon made in the Wuhan BSL-4 laboratory. Francis Boyle, professor of international law from the University of Illinois, has made some scientific journals, articles public. The first is in antiviral research on February 10th, 2020, and it was published by 3 scientists from France and 1 from Montreal who did genetic analysis on the Wuhan COVID-19 virus. They stated it may provide a gain of function of the 2019 coronavirus for efficient spreading in the human population compared to lineage B beta coronaviruses. What that means is that COVID-19 is actually an offensive biological warfare agent. Professor Boyles, and I have these articles here that I can leave for you to review. Professor Boyle states that gain of function is a tip-off. It's only useful for offensive biological warfare agent activity, and it's so dangerous that it is typically conducted either in a BSL-4 or a BSL-3 facility, and Wuhan, China is where the only BSL-4 facility is located in China. So gain of function means that it is DNA genetically engineered to be more lethal and more effective. It's basically SARS, which has been weaponized. Gentlemen, I think we're all aware that we were even told this week that there was a cyber attack on our nation from China that they're declaring as a cyber Pearl Harbor. So we live in America, we've saluted the flag, we're standing for our republic, but really we are at war. And I think we do need to look at this, and North Carolina plays an interesting role because the second journal article that I have here is from NatMed, which came out of the University of North Carolina, Chapel Hill, and it's entitled SARS-like Cluster of Circulating Bat Coronavirus Emergence. And in Chapel Hill, there's a biosafety lab level 3 where gain of function work was being done on MERS, which was Middle East Respiratory Syndrome, to make it more lethal. And just quickly, a grant was given to the University of Chapel Hill by China, and Xing Li Shi came from that lab in Wuhan to do that kind of biological warfare work here in North Carolina. I think we need to be aware of what's going on around us. I'm asking tonight that the vaccine, which is also an mRNA vaccine, which changes our DNA, which changes our genetic makeup, which has very serious effects that have been documented by people who have already taken it, not be mandatory in Haywood County, and that our religious exemption or medical exemption be honored, and that we can count on you to put in writing that it will not be mandatory in Haywood County. And that's my request tonight of the council.
Okay. Thank you, Mary. I don't have anyone else signed up to speak. Would anyone else like to address the board tonight? Okay, seeing no one, I'll close the public comment session. Okay, our next order of business is our constituent concerns. And I'd like to start off tonight by recognizing Julie Davis, our finance director. Tonight will be her last commissioners meeting, and she'll be retiring. And Julie, the board would like to give you a gift tonight. And our longest serving commissioner is Commissioner Kirkpatrick, but unfortunately he's not here tonight, and so I'll have to get Santa Kirkpatrick to give you this. Gift. So Santa, if you would present this to Julie, I'd appreciate it.
Oh, this is what I'm best at. Giving up presents. Oh,
Thank you, Santa. Julie, would you like to say something? Yeah, we'd like for you to.
I would like to say just a few things, and it won't be but a couple of minutes. It has been such an honor to be the finance. It's been the most interesting and the most fun job I've ever had, if you can believe that. We finance officers tend to measure time in terms of audit seasons, and it occurred to me the other day, my first audit season was actually the fall of 2001. In September of 2001, we went through 9/11. So I came in with 9/11, and I'm going out with a global pandemic. So through all of that, though, I appreciate all the support from all the commissioners, all of you, all the commissioners and the boards that have gone before you, the county managers that have gone before. I really appreciate all that support. And the department heads at the county have been wonderful to work with. Haywood County department heads are some of the best in the state, and you ought to be very proud of them. And I know you are. And my finance staff, it's like no other, and there are a few of them here who've even come from vacation to be here tonight, and I appreciate that. We're like a family. Some of them have been with me for 11, 15, and 17 years. So I really appreciate them. But in order to have put in all the time, the overtime and the hours and all the work I have, I couldn't have done it without the support of my wonderful and patient husband. You commissioners are so dedicated. You're so dedicated to the citizens of this county. You have tough jobs, and you do them well. I feel like I'm leaving everything in excellent hands, so I thank you.
Okay, thank you, Julie. Okay, well said, Julie. And I know your office has won so many awards, and you know the county should be, the taxpayers should be very proud of the awards that you've won, because I think it transfers to that you've saved the county a lot of money. I know you have, just in some of the way you've approached things, and I know, I appreciate your service, and I know anytime you've served. Kirk and I were elected in 2002, and so I guess we've all, kind of served parallel, if you will. And I know anytime we've ever had an issue, you're my first person I want to know what thinks about, is it worth it or spending the money, because I know you've always given us good advice, and if we don't take your advice, we regret it later. At least that's what I've seen. So you've never led us wrong. And I think that's a great point. And when I heard you were leaving, it was like, oh no, So, but I know you've got some good staff that you've trained, and I know you've trained them well because they've served under you. And but you came on, and like I say, you've always been one of the bright spots in the county for me as a commissioner, and I appreciate all your service. Would any other commissioners like to say anything?
Well, I would like to echo what Mr. Chairman said, and I've already spoken with Julie privately, but I've been a privileged man to be able to work with Julie in my short time here, and I know the county, the county has been well served by you, and we really appreciate your service, and thank you.
Just to add to what both these guys have said, I've only known Julie, I guess, for 4 years, but it's been a good 4 years. I can say that I come into this position with open eyes, especially on the financial side, and wanted to look and see where all the money was going. And one thing I learned real quick was that I didn't have to worry on the financial side of things because Julie took care of everything. So we appreciate your dedication, the time you've given to this job. I know a lot of people could come in and do the job and go home, but I feel like you go above and beyond, and we appreciate that. And we wish you a happy retirement, and don't go too far. We may have to call you from time to time.
Yeah.
Well, Julie, I must say that all these people have some very fine things to say about you. And it has been a pleasure to know you all these years. Of course, I've known you since you were just a little girl. But the one thing about you we always know is trust. We could always trust you throughout the years, no matter what. We could trust that the numbers were right, that you were telling us the truth. You might have been a little bit stingy every now and then, but that's okay. The only thing I'm concerned about is how happy you seem to be about leaving. I wish you a wonderful retirement.
Thank you, Julie. I know through the fire department, many years having to submit budgets and different things that we had to do, you've always looked out for everybody. Even sometimes it didn't make you the most popular person in the world, and you had to make some of those bad decisions. But we appreciate everything that you've done for all the citizens of Haywood County.
And Julie, I also want to mention, I did talk to other folks that would have liked to have been here, but because of COVID, you know, they didn't, they just didn't want to be here. But I talked to former Chairman Mark Swanger, and he wanted to wish you the best. And Marty Stamey also, I've talked with them, and they want to wish you the best. So, but okay, does anyone else have any other constituent concerns?
I had a few, Mr. Chairman, but I got them resolved and tried to answer some constituents' questions, a lot of them around COVID, and consulted with the county manager and our county attorney, and I think we got people the answers they were looking for. So thank you.
Anybody else?
Well, I know I'm going to think twice about going to China this year for Christmas. We'll say that.
Okay, then our next order of business, does anybody else got anything? I can't top any of that, that's all I know. Okay, our next order of business is our administrative and agency reports and presentations, and we have a COVID-19 update from Interim Health Director Garen Bradish and Medical Director Dr. Mark Jaden. Welcome, gentlemen.
Well, good evening, and thank you for having us back. Before I get started, just a couple of comments that I have to make. You know, all through this pandemic, we have been looking for a silver lining, a light at the end of the tunnel, and I think Julie has shared that with us tonight, because if Julie brought in 9/11 and she's going out with the pandemic, I think there's hope. Thank you, Julie. I'd also like to make a comment that Santa looks a little thin to me. I guess it's been a rough year.
Have you not seen that new bicycle commercial, Mr. Jabin? I have to check out the television. You can see that I'm in real good shape underneath this outfit.
So today, 48 out of the 50 states in the United States are in the red. Only Hawaii and Vermont are not. 95 out of 100 counties in North Carolina are now in the red. In western North Carolina, only Clay County is not. In Haywood County, whereas 2 months ago we were adding 20 to 30 cases, new cases a week, we're now adding 200 plus cases a week. 80% of those, by the way, are out in the community. Less than 20%, as of December 1st, since December 1st, less than 20% have been in long-term care facilities. There have been 66 deaths, 15 this month alone, all in people older than 60, but in nearly every case contracted from someone younger. The themes remain the same: gatherings, traveling, workplace where people either don't practice the full precautions or don't do so all the time. And it may have worked in the past because there weren't that many people in the community infected. Less chance you would come in contact with somebody infected, but the chances of being in contact with someone now, with the increased prevalence in the community, the odds are no longer with you. Right now, you can assume that in any group of 10, there is a 22% chance someone there is pre-symptomatic, asymptomatic, contagious, which is symptoms have not started yet. In a group of 50, that's a 70% chance that somebody there is contagious. And how many are we in this room right now? You know, when Garen and I were here last, we said that whatever we report would depend on what we in the community do. So this is the curve of new cases by day for the country as of the end of last week. And interestingly, it mirrors exactly the curve we now have in Haywood County. The only difference is you'll see after the bump in the middle, it went down somewhat. Here in Haywood County, we actually got it much lower than that, which is why we're better off than a lot of places right now, even despite our surge. But I'd like to point out a couple of other things about that curve. We know there's an ebb and flow to the virus and to cases. And when there is a surge, we know that at some point it will peak and it will come down. This has happened everywhere in the world that has had a surge. So you can see that the curve accelerated at the beginning of November. And you can also see a small inflection where the rate started to come down just a little bit right before Thanksgiving. I think we had hoped it would come down more, but you can see the bump that we got from Thanksgiving. Off it went again. And you'll notice the question mark because it may be reaching a peak right now. If so, we have a window of opportunity because we will not see a bump, if any, from Christmas until 7 to 10 days after, until after New Year's. And so right now we have a 2-week period where if we can drive the cases, the rate of new cases lower than what we saw before Thanksgiving, unless we do that, the curve is going to shoot even higher. There are those who worry about a slippery slope, and they proclaim, my body, my choice, and they believe that if one right is taken away, soon they will all be taken away. And that's certainly possible. But where is the evidence that that is actually happening right now? Well, here's a slippery slope you can see. No need to wonder if it might be happening. It is happening. And that slippery slope means more cases mean more hospitalizations mean more deaths, a pattern that we've seen over and over and over. And it's not just that. I believe you all know about the White House security official who contracted COVID, no doubt on the job, from others not being careful. After a 3+ month long illness, had his right toe, left foot, and left leg amputated. Or there's a healthcare worker right here in Haywood County, just now returning to work after an infection. Their spouse brought it home from work, and the spouse ended up on a ventilator. This person was so fatigued they could not work for 5 months and still are not fully recovered. Sadly, one of the recent deaths was a person whose family came to visit for Thanksgiving. Unbeknownst to any of them, one of those family members had been exposed a few days before to a coworker who subsequently tested positive, unknowingly giving it to their parent. A week later, the parent got sick. A week after that, the parent died. I have a colleague who works in another state in a hospital about the size of Haywood Regional. Just last week, he told me that the hospital was full, the ED was full, there were 4 ambulances waiting outside and patients in the waiting room. He called 24 hospitals trying to get some of the sickest people transferred, people who needed a higher level of care than they could give. None of those 24 had any space. This is the real slippery slope. And when it gets like my colleague is experiencing, and like it is in many places in our country where the healthcare system is overwhelmed, everyone suffers, whether you have COVID or not. Right now in Western North Carolina and in Haywood County, I'm happy to say our healthcare system is not overwhelmed. Hospitals in the region are seeing about double the number of admissions and ICU stays, but for now it's still manageable. But as staff and doctors get sick and have to be out and can't work, it gets even more slippery. You know, I looked up the definition of tyranny, a government in which absolute power is vested in a single ruler. But there's also another definition, a rigorous condition imposed by some outside agency or force. And some worry about the prospect of tyranny by the government, and I guess it's possible. But I wonder about a tyranny of a rigorous condition imposed by some person on others. When a person's choices, actions, or lack of actions force a condition on others, that security official, that healthcare worker here in Haywood County, the doctor struggling to care for their patients, the family coming to grips with what happened, another person's choices, actions, or lack of actions forced a condition on others. Health and safety means not only physical health, as we've talked about before, but emotional health, spiritual health, economic health, and political health. But focusing on one at the expense of others leads to choices with unintended consequences and undesired results. So why do I bring all this up? Because right now we have a window of opportunity. The more we can keep people from getting infected, the less suffering and dying, the more effective vaccines can be. There are many in this community who are being really careful, and to you I say thank you. There are many who are doing so but let down their guard sometimes, and for you I say thank you as well. And there are many who have rethought their positions as we've learned more and been willing at least to adapt some of what they are doing. And to you, I say thank you as well. there are many who, by their choices, continue to inadvertently contribute to the slippery slope. And I'm not suggesting that there's anything easy about this situation we all face. I am suggesting to consider the full range of what it means to be safe and healthy when you make your decisions. So now's an opportunity for everyone to pause, reconsider how you feel, redouble your efforts, and be willing to choose to do something differently, if only for the next 2 weeks, to put those you care about and those in your community in a better place starting the new year. That's the situation in Haywood County as of today. Now, I would like to talk just a little bit about the CDC came out with some changes to their guidelines in terms of quarantine period. Unfortunately, this has been a little bit misunderstood by people. You'll see in the top line, it's the current recommendation, which is a quarantine period. And let me just be clear that I'm talking now about people who are close contacts to someone who is positive. Nothing has changed in terms of the isolation period that someone who is positive and infected needs to follow. But for close contacts, a quarantine period of about 14 days has been the recommendation. And that 14 days means separation from anyone else, separation from family, separation from those around. That's been very, very difficult to people. The CDC introduced a couple of options. What they did not do was to shorten the 14-day period. It's still 14 days because the incubation period of the virus is up to 14 days. The options give us some room, if we choose to use them, to manage those 14 days a little bit differently. So option one, complete separation, is for 7 days, a negative PCR test 2 days before that 7th day, and the person can be released from the separation, but they could still become contagious in that time. So it is extremely important that that person be very meticulous about the public health recommendations and precautions, such as wearing a mask, keeping your distance, avoiding crowds, avoiding situations where if you become contagious, you could be a risk to others. Option two gives a 10-day period of complete separation. You don't have to have a test, but even then, you have to complete your 14 days. As you can see at the bottom there, of the people in quarantine, 8% turned positive, roughly. You can see the range that we've seen. And this is something that we followed over a couple of months up until recently. And you can see also that a substantial percentage of those who turn positive do so after day 7. We've already had a situation where a public service worker tested negative, was released on day 8, got really sick on day 11. The point here, and this is where this really becomes important, because of the modifications we've had to make at the health department, just because of the sheer workload and the inability for everyone at the health department to keep up with the workload, we have suspended our monitoring of people in quarantine. We're essentially asking people to do some of the work that we have had to do because it's just not possible with the workforce that we have, even with bringing in people from environmental services and other places to help out. So what we're asking is, if you get a test result that's positive, find out who your close contacts are. Even better, before you go test, once you make the decision to test, think about who your close contacts are, get in touch with those people and say, hey, we may have something going on here. And certainly, if you turn positive, let those people know they need to be quarantined. This becomes an especially important thing for employers. Now, this does not affect the school system. The school system contact tracing has been going on by the school nurses, and that will continue. It does not change what we're doing in terms of case investigation and supporting people who are positive and need to be in isolation. This is strictly for people who are close contacts outside of those two things. This becomes important for employers because a lot of employers have depended on the health department for a letter to say, hey, this person's cleared, they can come back to work. We can't do that now because we're not following people in quarantine. We don't know what the timeline is for people. So employers are going to have to decide what of these options they're going to accept in their business. And I'll give you some guidance in that. For instance, long-term care facilities are not to use any of the options. The reason is if somebody gets contagious at day 11 in a long-term care facility, that's a big deal. So the CDC does not recommend that. And we have taken that and sort of tried to apply it to employers in the sense that long-term care facility is a congregate living facility. People are congregating together. If your place of employment, your business, requires people to be on top of each other, to be congregate, then we would not recommend that you use one of these options. But you know, if you're like Kevin and you're a surveyor and you spend your days in the woods alone, One of these options may allow you to get back to work sooner, but that's going to become up to the employer to make a decision. I think the key word here is congregate. If your job, your work, your business requires people to be in close contact with each other, we would not recommend that you use one of those options, but that's what's out there. I wanted to cover that because it's been quite misunderstood in the community, unfortunately, and it has a big implication in terms of spread in the community. I'm going to give this to Garen, who's got some actually important stuff to tell you.
Good evening, Commissioners. As Dr. Jabin said, we have gone through and made some changes to our day-to-day working. We are still looking at all our positives, reaching out to them, and when we talk to them, we ask them to tell any of their close contacts that they were positive and advise them on basically quarantine. There again, we've come to that decision because of the sheer volume during this surge and how many calls we were taking. And to go through one positive case might take 45 minutes with all the contact tracing. We've sort of streamlined that, come up with our own questions that we use, and we've got those calls down to about 5 or 10 minutes now with what we're doing. We still are doing contact tracing for the schools through our school nurses, so none of that has changed. We are expecting in the next 48 hours to receive 900 doses of Moderna vaccine. When we look into that, we're going to be reaching out. The way this kind of works is the state has come up with a software program. It is the CVMS, the COVID virus monitoring system. We have reached out to doctors' offices, dentists, funeral homes, anyone that falls in the phase 1A, ask them to basically poll their employees, then provide us names and emails. Then we upload those names and emails into this CVMS system. They will get an email, each person will get an email that they respond to. It will come from nccvms@dhhs.nc.gov. At that point, they'll put in their information and they will have to do a short questionnaire to determine if they fit into the phase 1A or phase 1B category, or if they fit into phase 2. Then if they answer the questions correctly, it lets them know where they are and when they can get their vaccine, roughly. Ask them to set up an appointment with us. We'll be doing that. We're looking at in the next week to start setting up. We're going to do a practice run with the public health people of how we're going to vaccinate for those that choose to get the vaccine. And then we'll go from there and we may say, all right, we're going to bring these dentist offices in and set appointment times for them, these doctors' offices, set appointment times for them, and then work through it. Later on, we may end up having to go into looking at doing larger scale vaccinations, maybe use the fairgrounds where we have a drive-up vaccination program, and use the support from EMS and all the help they're providing to us to try to pull that off. There will also be a monitoring system for adverse effects. It is the VAERS system. This system has been around for some time. We'll be putting in any information we have to anyone who has any negative reaction. And then there will be a mobile app called VSafe that is for monitoring the COVID-19 vaccine. Each person will be able to sign in if they choose to, use their phone, and they will get an email within the first 24 hours after getting the vaccine, 1 week after getting it, then 3, 6, and 12 months after. Then it restarts on your second dose. So with Moderna, we'll be administering this first dose, and then we'll go in 28 days later and administer a second dose. We are, like I said, continuing to poll all those. Phase 1A will be nurses, physicians, dentists, EMTs, paramedics, home health workers, funeral home staff, and pharmacists. The long-term care facilities also fit in there, but they will be getting vaccines from CVS and Walgreens. Provide that. Phase 1B will start immediately once we work through Phase 1A, and those will be people that are over the age of 65 with 2 or more chronic conditions. They'll also be our law enforcement and our firefighters. So that's our plan going forward for now. Do you have any questions about anything we've discussed?
I think the key word there was you said those that choose to take it. I know the constituent concern earlier was whether it was going to be mandatory or not. So I did hear you say that those that choose to take it it'll be available to those people first.
That's correct. We've, like I said, done our own poll in public health, and it came in at about 55% of the public health workers that chose to take it. I think EMS has done their own poll. I know the hospital did theirs when they received the 975 of the Pfizer vaccine. So anywhere, we're seeing numbers from some places coming in at about 35%. We're a little bit higher with 55%.
Are you going to be administering the Pfizer vaccine or the Moderna, or what is the company that's providing the vaccines at this time?
We'll be getting Moderna. That's what we're expecting in the next 48 hours. The ancillary kits came today about 4 o'clock, and so we expect possibly tomorrow we could have the vaccine.
Is that because we chose Moderna, or is there a reason?
No. Actually, that went out to all health departments. So the Pfizer went out to the hospitals across the state, and Moderna was the second, and it went out to all the health departments.
I've got a couple of questions.
Please.
This is probably closer to you.
Okay.
Can you go back to the graph that you were showing with the progression?
Alan?
I remember from the conversation when this first started, they kept saying if we can make it till summertime, the virus is going to be harder to survive when the temperature rises. If that was in fact the case, now it's getting cold. Is this going to keep going up because the virus can live better in spite of everything that we're doing?
Well, I think those who wished that the hot weather would make the virus less fastidious unfortunately turned out to be wrong. I think, we've been saying from the beginning that we were probably going to see rolling waves of this for a while, and in fact, that's exactly what's happened. The spread of this virus is not necessarily because of the virus, although you may have read in the last week or two that they believe they have a mutated strain in the UK. Not much is quite known about that yet. But this is not, what we're seeing here is not because the virus has changed. It's because of what we are or are not doing. And so, Mark, I think we're going to continue to see these rolling waves. Now, the hope with the vaccine is that once enough people get vaccinated, then we achieve something close to something like herd immunity, in which case the virus dies out because it just can't find the next person to jump to because everybody's got immunity. What we know about this vaccine is that the trials were set up to show whether the vaccines prevent people who get infected from getting sick, and particularly seriously sick. It did not, none of the trials were set up to determine if a person gets infected. Let me say it this way. If a person is vaccinated and then gets exposed and gets infected, we know that they won't get as sick, but we don't know that they cannot then turn around and transmit it to somebody else. We'll find that out in the next couple of months. That's something that is being looked at. But it is why you'll see all the recommendations say that even once you get vaccinated, continuing with the public health precautions that we've talked about all along still remain really important. It will be great if these vaccines turn out to prevent transmission. That would really be great. But we don't yet know that. I think we'll probably have a better handle on that over the next few months. They will continue to follow the study participants for 2 years. So does that answer your question?
It does, but I'm glad you brought up the part about the masks and about the fact of once you get the shot, you can still transmit it. That was going to be my next question. That was something I saw, people saying that if you receive the shot, you have to wear a mask because now you can transmit it. I understand just enough to think that that's probably not true.
Let's hope. Yeah, let's hope. I think, again, there was some early data out this last week that suggested that they do prevent transmission. But again, we don't know enough to really say that quite yet. And I think the best way to think about it is if you get vaccinated, the vaccine protects you, but it doesn't protect anybody else. We hope that it will do both of those things. But right now, that's what we can say.
But just simply getting the vaccine does not make you transmit the disease. That's kind of the way it was being presented. If you receive the vaccine and you don't continue to wear a mask, you're going to give it to the people who did not receive the vaccine.
You can. That's right. That's what we will learn more about in the next couple of months, whether that's actually true or not.
So you'll find out, after these vaccines have been given out, you'll find out if you can culture in people that have received the vaccine.
I don't know how. I don't know the design of those trials in how they're going to demonstrate that or not. All I know is that that's going on. I can do some more research and let you know. But
yeah, that would be interesting to know, because I heard it and I was like, well, how do you go from being without the virus to now you can transmit it just because you received the vaccine?
No. It's if you. So the trials were set up with 30 and 40,000 people, and what they wanted to see was we give the vaccine. So half the people get the vaccine, half the people get a placebo. And what they wanted to see was how many people in each of those groups actually get sick. And in the vaccine group, out of 195 or 200, in one of the studies, out of like 200 people out of those 20 or 40,000 that got sick, out of 200 that got sick, 185 of them were in the placebo group, and like 10 or 11 were in the vaccinated group. That's how they come up with the 95% efficacy. Because you have to assume that groups being equal number of people should have gotten infected. Way less did in the vaccine group. So that's why they're saying that the vaccine is very efficacious in preventing people from getting sick. And incidentally, those trials were across all age ranges, races, ethnicities, etc. And there were, in one of the trials, no serious illnesses in the vaccine group, and I think one in the other trial. So the ability of these vaccines to prevent illness, and even more importantly, to prevent serious illness, looked to be pretty good in those early findings.
I'm out a fair piece of the time, and about 99% of the people, when you're out in any of the stores, shopping or doing anything like that, are wearing masks, but the numbers are still climbing. What's your best guess?
Well, I think what we're seeing over and over is that people are trying really hard. The great majority of people are. But I'll give you an instance where in a local business, 4 people turned up infected, and when you actually investigated that, they were all wearing masks while they were doing their work. But then they all went to lunch together, didn't wear their mask. Turns out that one of them had been exposed to somebody the weekend before who ended up turning positive. This person turned positive. In the meantime, they had given it to the other 3 people. So this is why it is so important for people to be diligent all the time, as hard as that is, and especially with the holidays coming up where we're going to be together. And if we're going to be together with people from all over the place, again, in a group of 10, you have a 1 out of 5 chance that somebody in that group is going to be pre-symptomatic and contagious. So that accounts for a lot of it, Mark. Now, nobody ever said that masks and distancing and all this stuff are 100% perfect. So we do have some cases, although very few, where people just don't know where they got it. So that's possible. But I would say that from our experience, if you wear a mask, well, if you avoid crowds, first of all, but if you're going to be in a crowded situation, you wear a mask, you keep your distance, you don't stay around anybody longer than 15 minutes, your odds are minuscule compared to if you don't do those things. And I think we had one previous time we were here, I showed you that tool where you can actually plug in these various actions and see how much it reduces risk. And I think, if I remember correctly, if both people are wearing a mask, it reduces the risk by like 80 or 90%. And if you throw in distancing, now you're up to like 95%. And if you throw in good hand washing, you're up to like 98%. Which means that if 100 people would have gotten infected, only 2 did. So we know that these things work. And we know that the virus is just interested in jumping from one person to the next. And so if you avoid being in close contact, if you avoid being someone that virus can jump to, that's your best bet for not getting infected.
So if you're wearing your mask everywhere you go, how do you get it? That's the important question, I guess, that keeps circulating around is people have started confronting others for not wearing a mask, and they have the misconception that if everybody doesn't have one, this thing's not going to go away. If you have yours on, how's the virus going to get from me to you or from you to me, if you have it.
Right. So if you have a mask that's perfectly sealed, right? Let's just say that I'm infected, all right? And I have a mask that's perfectly sealed, then when I exhale or I talk or I yell, that virus isn't going any farther than the mask. If I wear a mask and the sides are wide open, it's down under my nose, etc., I do any of those actions, now there's space for that to get out. Will it go as far as if I'm not wearing a mask? No, but it will still be out there. If you're in an enclosed space, small room, not great ventilation, and you got a bunch of people doing that, that virus can just concentrate in the room and move all over the place. So that's how that can happen, even if you're wearing a mask. What we know is if you wear this kind of mask and you wear it reasonably close to the face, that's going to restrict greatly the amount of virus that would get out if I was contagious. And so it's a matter of concentration and where you are in the room and who you're with and is your system susceptible at that moment. There's a lot of variables, which is why we see some people who are around people positive don't get sick at all. And we see other situations where a group of 10, 7 get infected. There's just a lot of variables to that.
Well, I understand enough, like the N95 masks and things that have to be fitted in order for you to choose the correct one. That's the only way to really stop it. A lot of the masks that people are wearing, I won't say they're wearing them down below their nose, but a lot of times you can see there are gaps on both sides. There's gaps on the side. Every time they speak, there's gaps. Part of this transmission can be just because we don't have the proper masks to stop it.
I think the better way to think about that is that a tighter fitting mask is going to be more effective. I mean, we have many examples now of people wearing masks like this in situations where there should have been transmission and others should have gotten it, and they didn't. I mean, the classic one is the hair salon in Missouri. It's been a couple months back, where 2 workers were infected and symptomatic and coughing and wore masks. They exposed 140 customers and 7 other staff people. Everybody was wearing a mask. Nobody got infected. So we know that even if they're not perfectly sealed, they're still effective in terms of reducing spread.
I guess where I'm headed is, unfortunately, Walmart is about the busiest place right now. Even though you have your mask on, there's a real good probability that if it's not the correct mask and it's not fitted for you, you can still come away with the virus. It's not because one person walked in there and didn't have their mask on.
Yeah. I think, again, we know that crowded situations are a higher risk because there's likely to be people who are infected there, even if asymptomatic. And in an enclosed space, it just allows that virus to concentrate. That's why one of the recommendations is avoid crowds if you can, because it just is going to increase the risk.
The last thing, a bunch of people are saying, news media-wise, I guess would be the better way of putting it, about the surges causing hospitals to be overrun. You made a statement a few minutes ago that our hospital was not overrun, that we still have beds that we're not at max capacity, which is where we don't want to go. But you think you can put people at ease a little bit about that we do have someone to take care of them if they get sick?
Well, if it stays like it is now, we're okay. We don't know where that curve is going. And that's why it's even more important, especially in this next 2 weeks. We just have talked over and over about crowded situations being higher risk, indoors, etc. If we can all pay attention and be careful with our family members and with ourselves through this next couple of weeks, we put ourselves in a much better position not to have that happen at the hospital. It's up to what we do. It's up to what people choose to do. And that's why I'm saying, regardless of how you've thought about this up until now, regardless of what you think about masks or distancing or any of this stuff, regardless of what you think politically, religious, or any otherwise, we can see what's happening. If we can spend this next 2 weeks and focus our attention on being just as careful as we can be and prevent this curve from going higher, then we can keep our hospital and our healthcare system from being overrun. I can't tell you, Mark, if we sustain another bump like after Thanksgiving, through Christmas, and then through New Year's, Garen and I are going to be back here at the end of January, and who knows what we're going to be telling you then. So, whether you believe in vaccines or not, whether you believe that this thing is real or not, whether you believe where it came from or not, This is what's here. And so our strong recommendation to folks is, regardless of what you think, consider this next 2 weeks a really important time. And if we all want to be able to gather safely again together sometime, which I don't think there's anybody here who would not want to be able to do that, the more we can keep this tamped down now, the sooner we get to that time, the sooner that vaccinations can be more effective in terms of a community sense of where we're at. So that's my hope, is that people will take what we're talking about, take the experience of what you can see for yourself, not what some pundit's telling you on TV, not something you're seeing on Facebook or anything else. Look at what we have. Look at where we could be headed, and look at what each of us can do, starting today, not to go there.
Dr. Jabin, let me ask a question about the vaccine. What's the shelf life on that vaccine? Do you have, how many lead days in advance are you given notice that you're getting a shipment? Is there a schedule that is known, and after you do the frontline workers and all those people that you went over, I get that, but you know, we've known early on that this thing's a old person killer. You know, most of our fatalities have been in our adult care centers or nursing homes. And do you have any idea how many folks we have in these facilities in the county, and the residual vaccine you have left over after you take care of all those frontline workers and everybody you listed? If you have extra, who gets those? What's the shelf life? And could you kind of elaborate on that a little bit, and how many vaccines do you think is coming? And of course, now with that, let me make a statement. You know, I've been pretty much on record as saying that we need to concentrate on our elderly population in the county. That should be our responsibility, and I think you guys have done a great job. Even though we've had some outbreaks, people were doing everything right, and even though they were doing everything right and taking extra precaution, we got it in these nursing home facilities, and it wreaked havoc. But what is your plan, you know, about the vaccine, making it available if they choose to take it to these nursing home facilities? And could you elaborate on that? And do you know how many you're going to be getting? Is there a schedule and the shelf life? Could you just kind of...
That's been kind of the question as we go forward. We find out every few hours this thing's changing with the state. They just keep reassuring that it's going to keep coming.
But do you get, with the initial shipment, do you get the second dose? Does it come at the same time?
No, no.
So it has to come within so many days.
Yes, once we go through the first, they will look and see what we've used. We'll end up going through all 900 of ours, and then they will go ahead and set us up for the shipment of the second dose to be there on time. There is a plan through monitoring this that they are planning to do, and we'll probably, the way this will look is we get this first one this week. I could see us getting another shipment possibly in another week or 2 weeks, and then also our second dose shipment will come in. So we'll be kind of scheduling this out through this monitoring system of how we administer that second dose when it comes in. But this 900 is all the first dose. We expect another shipment to come in, and then another shipment to come in. And they keep assuring us that this will happen possibly weekly or bi-weekly for some time.
And so the strategy for our nursing home facilities?
The strategy for the nursing home facilities is still going to be, they're going to receive, like I said, the vaccine through CVS and Walgreens. That was the plan all along from the state, was to use those two companies to basically go into those facilities and actually administer in those facilities.
And so that's a separate entity from y'all's
Yes.
purview?
Right.
So that's somebody else is responsible for that, CVS?
That's correct.
So our health department doesn't have a hand on that?
We do not, but there will also be others that we'll see that will basically file paperwork with the state to receive vaccine. We could see other medical departments and things like that within the county getting their own vaccine to help administer, maybe to their own patients and things like that. So it won't be us. Even there's been some talk of some of the businesses. If they have a medical director in their business, a large business, then they could even look at trying to receive their own vaccine for their own employees. Now, with the phases, with phase 1A and phase 2 or phase 1B. Once we determine that we've reached enough in that first phase of what we think it is, we have the ability to just make the call ourselves to move into phase 1B. It's not, the state's not going to tell us, all right, you now are going to switch and start doing this. It'll be up to us here at the county. They want each county to kind of monitor this themselves because of the different demographics from all the different counties.
Yeah, Tommy, I think the best way to think about this is there's 3 prongs. There is the Pfizer vaccine went to hospitals to cover the healthcare workers. The federal government is managing through these pharmacies, the long-term care facilities, and then the health department to go through the next people on the priority list. So that's the initial wave of 3 prongs. Each of those is a separate plan. Yeah. And I would just like to say there's been a lot of questions about should I get the Moderna, should I get the Pfizer? They're essentially identical. And I would direct anyone, I just did a video that's on the Mountaineer, it's on my YouTube site, it's number 113, it's talked about how mRNA vaccines work. It talks about how they work, it talks about the ingredients that are in them. You know, let me just say that there is no possibility that these vaccines affect a person's DNA. DNA resides in the cell nucleus. These vaccines, the mRNA in these vaccines don't go into the nucleus to do what they have to do. So that's something that's been out there and about that's just not, if you look at how it actually works, it's just not possible to alter someone's DNA with this stuff. The other thing I would say, there's a lot of concern by people who have concerns over the years with vaccines because they have chemicals in them or heavy metals in them or stuff like that. If you go look at the ingredients, it's fat, sugar, salts, that's about it, and the mRNA, that's about it. It doesn't need preservatives, it doesn't need adjuvants. It's actually a very simple package in terms of what's there.
One more question.
Please.
If you went to the Red Cross blood drive and they checked your blood for the antibodies, like several people in the county think they had it back in January and February. So if you test positive for the antibodies, does that person need to think about getting the vaccine, or is his or her body going to produce those antibodies naturally where they're already, as you said, herd immunity, or your body's already immune to that?
Right.
What's your...
Here is the challenge with that. When someone gets infected with coronavirus, SARS-CoV-2, they will mount some kind of immune response. We don't know how much of an immune response. We don't know how long that lasts. There is some indication that people who either had an asymptomatic or maybe mild infection don't mount as much of an immune response as somebody who has more symptoms in their infection. So the recommendation is that, yes, even people who have been infected or think they're infected should get vaccinated. There is some evidence to say that the vaccine will produce a more robust immune response than the natural infection will for some people. What they do say is, let's say I get coronavirus, I get SARS-CoV-2 tomorrow. They would not recommend me getting a vaccine for 60 to 90 days. So that's out there. The other thing I think bears interest for people who are interested in the vaccine, and I think we've said it, and I think Patrick Johnson said it early on, this is not going to be something that's mandated, it is something that's voluntary. But there are side effects to the vaccine, and then the side effects are very much like the symptoms of the illness, which is exactly showing that your immune system is working. Symptoms in an illness are from your immune system. It's triggered, of course, by the infectious agent, but it's really your immune system that's causing the symptoms. So how do you know if you get vaccinated today, how do you know if you get side effects or if you are infected? And the recommendation is that side effects from the vaccine should happen within the first 24 to 48 hours, and it should only last a day or two, whereas SARS-CoV-2 infection, COVID, will last much longer than that. So these are all things that we're going to have to manage. You probably heard that there have been a couple of people who've had anaphylactic reactions to the vaccine. Anaphylactic reactions are a very severe form of an allergic reaction. So think about somebody you know that got a bee sting and died. That's an anaphylactic reaction. There have been 3 of those in the world right now that I'm aware of. They were all in people who had a history of that sort of anaphylactic reaction. So not the person with a seasonal allergy, not the person with a food allergy. These are people who had very, very serious reactions. And it should be noted that all 3 of those were managed without any problem to the person. They recovered perfectly well. So again, there are going to be side effects, there's going to be reactions. We're going to learn more as we go. But the evidence to date suggests so far that we're not seeing any sort of widespread severe reactions, certainly nothing that would compare with having the illness on your own.
There's no recommendation to isolate after you take the vaccine, like it's a killed virus, it's not a live modified virus? Am I correct?
It has no virus in it. There is, the mRNA is a manufactured piece of genetic code. The way mRNA works is your DNA is actually built, it's a blueprint. It's a blueprint for certain proteins that are made outside the nucleus in the cell. What the mRNA does naturally is to take that blueprint, read the blueprint, translate that to the machinery out in the cell that does the work. What these vaccines do is they make an mRNA synthetically that codes for the spike protein which is on the surface of the SARS-CoV-2 virus. That's how the virus gets into the cell. It basically hijacks the machinery to make this protein. That protein gets ejected into the blood, your immune system sees it and responds. And so that it's ready for that if you get an actual infection, you're already ready to go. Because it takes 10 to 21 days for your antibodies to rev up once you get infected. The way a vaccine works is it's got you primed and ready for when the virus shows up. So there's no piece of virus, there's no killed virus, there's no live virus. Other vaccines have had those in, but this is not one of those.
Okay.
Right.
Thank you.
Yeah.
I know this is probably the million-dollar question again, but how confident are you guys, being health department guys, about folks getting this vaccine? You know, I'm pretty decent with math and can learn to trust Julie maybe, but to be honest with you, I have a hard time with something new like this when it's coming out to know, because we don't know. We don't know what the effects are, if it's going to work, not going to work. So how confident are you guys with this vaccine?
Well, I think if you look, it is extremely unusual for a vaccine in any sort of its trials to have this sort of efficaciousness, first of all. Secondly, if you look at the trials, I think again, I'd have to go back and look, but in one of those trials, out of 40,000 people in the trial, there was like 1 or 2 serious reactions. So say 1 out of 20,000. Yes, there is risk there, but you've got to balance the risk of that side effect against the risk of having this infection. And if you're one of the 80% of the people that has this infection and it's mild or it's asymptomatic, great. But as Tommy has said all along, we've got to concentrate on our long-term care facilities. Where do you think those people in the long-term care facilities got this infection? It didn't appear in the long-term care facility. Somebody brought it in. So if we want to protect the people who are at the greatest risk of death, it really takes all of us not to be the conduit that gives it to somebody who takes it into the place. So it's not so simple as just isolating those people out and say, well, we'll vaccinate them and that's fine. It's all the rest of us that are really, really the problem for those folks. So the answer is that you've got to balance the risk of a side effect against the risk of having the illness. Where do you balance that? Which do you think is a worse chance? 1 out of 20,000 or what we're seeing? In terms of the effectiveness of it, and you'll hear things bandied about, but efficacy is the term used in a trial, in a study, to say how did it work. Effectiveness is how it works when you're actually applying it to the real world population. And effectiveness is always a little bit less than efficacy. But holy cow, if we start at 95% efficacy and it drops to 90%, that's in the history of vaccines, that would be phenomenal if it works like that. So, but I think it's a balance, Brandon. I think people have got to weigh how much they are going to deal with a mild reaction or perhaps one of these 1 in 20,000 reactions. How much would they rather take their chance getting the infection and what may happen?
I guess maybe what I'm looking for more than anything is, I know this has to get FDA approval before they can put it out, but how many times do they approve something and they have to go back and change the vaccination? I mean, for example, the flu shot that you get, how many times do we have to go back after the approval, or is there a percentage number that they give us so we feel more comfortable about it?
Yeah. Well, that speaks to the whole emergency use authorization process. I don't think there's ever been a vaccine that's gotten emergency use authorization because we've never been in this situation. Usually a vaccine will go through the initial study trials like these have, and then they'll go through a period of a couple of years where they're monitoring for side effects and other sorts of things. So by the time it gets actual approval, it's got all that history of experience. In this case, we're not doing that because we've got an illness that's overwhelming. We've got something that looks good. We're willing to take that risk. But again, it's that risk of that side effect versus the risk of the illness. And we've had to make an educated guess about where the biggest risk is. And I think for people, you know, if you're holed up in your house, you're wearing a mask all the time, you're not going out, you're not going around anybody, and the thought of a vaccine really worries you, stay doing what you're doing, you're probably okay. If you work around a bunch of other people, if you're out and about all the time, that risk is a different risk. And that's what people have to weigh. I can see that didn't answer your question.
No, it did. I'm just looking for some comfort there. I mean, it's not that I'm totally against it. I'm just trying to help myself understand how it is approved. Like I said, from a financial standpoint or a math problem, I can figure that out pretty easily. But when it comes to something like this, I don't know all the details, how things are approved, the approval process, and I just want to feel confident and comfortable that it's okay. I guess that's why I'm looking to you guys to say how confident are you that this, to the best of your knowledge and ability, that this is going to be a good thing. I just don't want to see us implement something or do something like this and cause side effects later on down the road, you know, years down the road, or even right away. So I guess I just don't want to see us spin our wheels and not get nothing done, just make things worse. So.
Well, I would add that, you know, if we just think about the process of even getting to the EUA, you know, the data was really reported to an independent panel. It was not reported to the company. The company had no idea what the data really was. And the FDA reviewed it, independent panels have reviewed it. So that's just a measure of the links that they went to try and be as clear as we can be about this. You know, they've been very transparent about this. All the data has been readily available, and that's unusual, I will say. Heck, even the advisory committee, which is separate from the people doing the study review, they were on TV, right? Their whole meeting was on TV. You could watch it yourself and listen to what the concerns were and what people had. So I think the people who are doing this understand the credibility issue amongst the public. This vaccine was developed really fast, and that has some people concerned, but here's the fact. mRNA technology has been around for 10 or 20 years. It's not necessarily new technology. It is new technology for use in a vaccine, but the technology itself has been around for quite some time. The reason that this all happened so fast is, well, let's talk finances. If you were going to develop a product, would you go manufacture that product before you knew if A, it even worked, if you even had a market? No. And that's how it usually happens. There's development, there's trial, there's approval, there's manufacturing, there's distribution. In this case, those were not done in series, they were done together. You may be aware that when they went through their early trials and determined that there was an immune response from the vaccine, they started producing. That's why we have vaccine coming last week to the hospital and this week to us. Because they've already been producing this stuff, even though they didn't know if it would be approved, didn't know if it would work. They took that chance. That was the role of the federal government in terms of bankrolling that, which is why this process is compressed. So it's not like they've cut a lot of corners to make it happen fast. They just did it in a more efficient way. So again, to the extent that that helps people feel a little bit more comfortable about the data that's come out, I hope that it does. It certainly has been to us.
I think also wasn't there 40,000 people in the study? So I mean, Pfizer, 40,000.
Right. So the Pfizer trial had 40,000 people, 20,000 in the placebo group, 20,000, and the Moderna trial had 30,000.
Yeah, most drugs, when they're trying, you know, you're just a few hundred people.
Yeah.
But you've got 40,000. Well, so you're talking about 70,000 people that they've been able to, you know, go through the trials, I guess, and everybody was, you know, volunteering for it or whatever, and that had gone through it. So that's a comfort level to me anyway. Was when I read that, I thought, wow, that's a lot of people that are that could have adverse reactions, if you will, and you know.
Yeah, it's a good point too, because that's also why this timeline has been compressed, because so many people chose to be participants. Usually, you got to twist arms, and it takes a long time to get enough participants.
And you do 2 or 3 studies with 500 people. I mean, I know. You know, I've studied, different, when you study different diseases, and, I'm real concerned about some, and, I look into them, and it's like, this is a big pool of people, and everything. So that helps me anyway, is to know that there's that many people. The time frame, it has been compressed somewhat, but, that many people, I think, that gives me a comfort level, I guess you could say. If you're looking for something, that's a good one.
And I guess as people are making their own choice about what they want to do, I think it's important just to understand how this process has happened, just for those sorts of reasons, because at the end of the day, people have to make their own choice, and they have to make it based on what actually happened and what the data is. So.
Yeah, and I think it's up to the person, the individual person, to do to make that determination for themselves. I mean, ultimately that's what it's going to be. Whether you want to take the risk or if you'd just rather wear a mask, and go with that, go that way. So.
And I would also just want to add that for this vaccine to have the overall benefit in the community that we're looking for it to have, enough people have to be vaccinated, and enough people have to be vaccinated for long enough that they have immunity that develops. So as we roll out through these phases, understand that these first shipments are just the beginning. These companies will ramp up, and so the amount of shipments will go up over time. They're saying that by January they'll be manufacturing considerably more than they are now. Also understand that there are at least 4 other vaccines that are coming down the pipe, which will all have their trial data roll out in January, February, March. So provided that things go well with those, so we have a variety of vaccines, so that we have a supply that can cover everybody, that's why you're seeing this roll out in phases. But it's not going to get to the general population until probably the late spring if everything goes right. And so the best estimates that I understand is next year at this time, we may very well be in a position where we can relax a whole lot of the stuff that we're doing. And that may sound like a long time, but if you think we've already been through it almost a year, let's keep it in the road. Let's keep people as safe as we can be. Let's reduce the infections, hospitalizations, and most importantly, let's reduce the deaths and the long-term consequences that some people who even survived this have. The more we can do to reduce that now and let this timeline roll out, we're closer than we have been to being in a position where we can safely gather together again. So it makes it even more imperative now going forward that people, if you haven't thought about doing these things or you haven't wanted to do it or you've got a really good reason for not wanting to do the public health measures that we recommend, take another look. I'm happy to talk with anyone anytime about how you balance all this sort of stuff, where the benefit is to the population. So please look me up if people want to talk about that. It's just really important right now that we get it, we continue going with it, and that we stay the course to let this vaccine and the vaccination program do what it can do for us all. So with that, a lot of people think that it can't happen to them, but I think we have enough stories in our community of people surprised that it was them. So it can happen to you. And I brought back an even more refined Swiss cheese model. I know how much, well, when Kirk was here, I know how much he really liked that. I don't know, Santa, if you liked it or not. But this is an elaboration of that Swiss cheese model. The more things we put in place, the less the holes line up. Nothing is perfect, but the less the holes line up, the less the virus is able to get through. And you will see in there that there are some things under personal responsibilities, some things under shared responsibilities. I don't think there's a one of us in this room that doesn't believe that people should take responsibility for what they do. Personal responsibility is really important. Over the next 2 weeks, if you think strongly about you want to take advantage of some actions that can really help our community, this is a place to start. And some of these things are personal, individuals need to do. Some of these things are things we can do together, and we are doing together. And the more that we can do it together, the faster we'll be able to safely gather again and be healthy. So I want to thank all of you for your time. Thanks for your questions. Thanks to all of you for being here and those of you watching. Again, if you have any questions or concerns of what you've heard, want some more information, please reach out to us, the health department. We're happy to, and we want to hear what people are concerned about. We want to be able to answer their questions so people can make good choices that work for them. So thank you very much. Gary?
Thank y'all. Our next order of business will be, our next item of the agency reports is our 2020 reappraisal update. We have our tax assessor, Judy Hickman, and Tanner Evaluation President Jimmy Tanner here tonight. Welcome, Judy and Jimmy.
Good evening. Just wanted to give you a brief update of where we are on our 2021 reevaluation. Currently, we're still doing a few property visits. We're winding down on those. We're doing some final reviews, and of course, we're still monitoring what the market is doing. But the main topics that I want to go over for today is the impact of COVID and some of the changes it has brought to our procedures, the customer service program, the mailing of our new value notices, the purpose and what you can expect during the appeal process, and then at the end we want to show you some examples of what our market is currently doing. The impacts of COVID and how we will manage the appeal process, there's a lot of moving parts when it comes to conducting a reevaluation, and there's a lot of pre-planning that goes in place with that. As part of that, we have to develop a new notice of value. And so due to the unknown of where we're going to be with COVID and for the safety of our citizens and our staff at this time, we have decided to remove the walk-in by appointment option. Now, that doesn't mean that people cannot appeal. There's going to be other avenues, and there's also going to be the customer service as long as we can still bring people into the building in a more controlled environment. The other avenues that you can use to appeal your property value includes the mail-in option, where all you have to do is complete the bottom portion of your appeal notice and return it to our office. You can attach any kind of documents or photographs, that's useful to your appeal. And we'll also have the electronic appeal option, which is where you can go online and file your appeal online. And it also gives you the option to attach any documents that you have regarding your appeal. Okay. Depending on the county and the state restrictions, the Taxpayer Appeal Assistance Program, we're still going to have in place as restrictions will allow us to bring folks into the building. We're hoping to have it in the conference room down on the main level where we can bring folks in, and we will assist folks with pulling sales within their neighborhoods. We'll assist them with pulling any kind of aerial photography. Anything that we can do to help with their appeal is what we're going to be there for. The mailing of the new value notices, we've said that we've expected to do those anywhere between February and April. Right now, we're currently looking at mailing them out in March. There's always some issues that could affect that mailing date. If COVID affects any of our staff members, that may set us behind a little bit. But we just want you to be assured that we will not mail the notices until they are ready to be mailed. During a reevaluation, regardless of the work effort you put into it, nothing is ever perfect, and that's why we have an appeal process. And it's designed to identify and to correct any kind of misapplication or any kind of errors that you may see on your property record card. It's always our goal to have the correct information, but that's what the appeals process is for. So if you see that there's something incorrect, then we want you to notify us and come in and talk with us so that we can, it's important that your values correct us. Some of the reasoning for appealing, a lot of people look at the percentage of the increase or decrease, and that's not a valid reason to appeal. But what you need to ask is the value reasonably correct in relation to the actual market value? And then we have some examples. Jimmy Tanner has pulled some sales, some recent sales, and he's going to go over those.
Good evening. We just wanted to just give you an example across the county, just some snapshots of, where the market's at, what the 2017 value is, not saying what the values is exactly, but, just an indication of what some of these values is going to be going to. And this doesn't mean everything's going this way. It's just showing you how broad a range the market is on certain properties. For example, this is a commercial property over in the Canton area that sold in November of 2020, just a month ago, for $435,000. The 2017 value is $358,900. You know, if we was to take that to market value for the reappraisal, it'd be a 21% increase. Let me figure this thing out. Yep. Here's a residential property in the Canton area, sold in October of 2020, 2 months ago, for $190,000. The 2017 value is $100,000. You know, that's an 89% increase in value. And I'm showing you this because there's a lot of different reasons why values go this way, they go this way, they go this way. You know, properties that's been completely renovated in the last 3 or 4 years, obviously there's going to be a bigger increase in value. Properties that's had improvements added that wasn't picked up through the normal construction process, that's going to mean a larger value. If somebody's taken away something, they had tore down a building or tore down a valuable building on their property, you know, that'll decrease the value more than, for example, their neighbor. So there's a reason, and that's why we're kind of showing you this, where values go a lot of different directions. But it all comes down to what's the value for January 1, 2021. And for example, in the Beaver Dam area, this sold in November of 2020, a month ago, for $254,000. You know, for 2017, the value is $143,700. That's a 77% increase. In Maggie Valley, November, and as you can see, all of these sales is from the last month or two. $475,000. The assessed value for 2017 is $326,500. That's a 45% increase. Another property in Maggie Valley sold for $180,000. The value is $138,500 for 2017. That's a 30% increase. In Waynesville, here's a property sold in November for $220,000. The 2017 value is $180,000. That's a 22% increase. And another property in Waynesville, $185,000. The 2017 value is $89,300. You know, that's a 107% increase going to market value. And that's basically, you know, that's not every property. You know, trying to show you a broad spectrum of properties that's not got that much increase. If somebody's completely renovated the house like a lot of people do when they get ready to sell the property, it's going to have a larger increase because it's not really the same property it was in 2017. So, you know, we just want to give you a little snippet of what some of the values look like throughout the county and where the values may be going. And, you know, of course, if you have any questions, you know, we'll have plenty of time for that ahead of time, but if you have any questions, we'd be glad to answer them if we can.
Anybody have any questions? I know I see this. I know Santa Claus down there sees it too, so.
Oh, yes, yes.
Yeah, I mean, you know, typically, even if you're not in the market of selling your property, or if you've not bought one, you've probably seen some neighbors or your relatives just bought or sold a property in the last year or so, and you got a good idea of what the market's doing. The market's, you know, the market's really good right now. You know, a year ago, we were really hesitant because we didn't know what was going to happen in this COVID. You know, I reckon that's one of the things. I'm still surprised it's not affected the marketability of properties, other than it's continued to go up. It's, you know, just sometimes things fool us, and this is one of the times. The market's continued to climb, you know, which is good. I mean, nobody wants the property to be devalued. I mean, I know from the tax standpoint, it's nice to say, oh, yeah, your value's less, but, you know, we really all want to buy a property and note in a year, 2, 3 years from now, the value's going up. That's really what we hope to have. And that's what's happening now, so that's good. We don't want to see the days of 2008 and 2009 again. So,
yeah, I know 2011, we were having trouble getting sales just to compare to, and now you've got a plethora of them.
We have got a tremendous amount of sales, and, you know, and that's why we said we just wanted to pick some out just to show you, you know, what we're seeing, what the market's doing. And that doesn't mean, you know, if this property is 100% increase because it's been completely remodeled, the next door neighbor's not remodeled, that's not the increase he's going to have. So just trying to say there's a lot of different reasons value go different directions. So, the biggest thing is, you just can't say, well, his only went up 10%, mine went up 60%. There's probably a reason. And, part of the customer service thing that we want to do, we may be limited on what restrictions we in at that time, but we do have an area that where people don't have to come throughout the building. It's right in the lobby in a room. So we still hope to be able to do some customer service where we can sit down and explain these things, show them what's going on with it. So we're still going to do that the best we can, depending on what this virus does in the next 2 or 3 months. The assessor's office has been affected with the virus. My staff's been affected with the virus. We just hope we don't have nothing in the next 2 or 3 months. Everybody's healthy right now. So if we can just keep them healthy for another couple of months. This is trying times for everybody, and we don't want to add more bad news with increased values, but, really, if you think about it, increased values is good. Haywood County is a really good place to be. The market's showing that. You can go across counties in the state that's not having the pattern you're having here, and that's not a good thing. So.
Okay. Mark, go ahead.
So whenever you figure out the value of a house, you're using the market value?
Yes, well, basically on the reappraisal, what the reappraisal is whatever date your reappraisal is, for example, Haywood, January 1, 2021, that's where you reset the market value, regardless of what the value was before.
So where does cash value play into this? Right now, you could sell a one-room outhouse for $100,000 in Haywood County because everybody's trying to get out. If you want to raise it by $50,000, spend $200 putting running water in it. I mean, to me, that doesn't seem fair to the citizens that this virus right now is driving the cost up. And I deal with it on a regular basis, but I have to figure out what it costs to rebuild a house. I don't care if they sell it for $1 million. If somebody's willing to pay that for a $200,000 house, I'm okay with it.
All right.
So where do we get to the real value of what this house, property, or otherwise is worth if we're just using market value? We're letting the real estate company dictate what we're getting.
Well, I mean, theoretically, if you've got this house and you've got another house exactly like it, if this one sells for $150,000, why would not this one? Now, we do know everybody's not in the market of buying and selling their property. You've got people here that built a house 50 years ago. They're still in it. They're not going to sell it. But it's apples and oranges, really, what it comes down to. If this house with these amenities and these features sells for this, you would expect the house just like it to sell for the same thing. But, we look at them things, and we look at the market patterns and try to figure that stuff. That's the not easy part of it. If every property sold, it would be easy because it would simply be, that would be the value. If everything sold in the last month or two, it would be easy. But the hard part or the fun part of this stuff is taking the 1 or 2% or 3% of the population that sells and extract that market data from it and be able to apply back to all the properties that's not selling and make sense of it. That's why, when we come here, the plan was the customer service part, because a lot of people don't understand where the value comes from. And that's what we're really pushing. We want to do the customer service part where we can sit them down and show them data and make sense of it. And obviously, if we've got something wrong, that gives us an opportunity to fix that, which is what the appeal process is for. So, one of the beauty things of the appeal, of the reappraisal, is the appeal process. That gives us a chance to learn something we didn't know about a property. We don't go in properties, even with the COVID now, we certainly don't go in properties. So, a lot of times something about a property that we don't know. We can walk around it, we can see it, we can take pictures of it, but we don't know they got termite damage. We don't know that they had water damage that's not been repaired. So there's a lot of differences, like you were saying, there's a house here and a house here, and they look the same, but they could be completely different values. Sometimes it takes the taxpayers to help us understand what that difference is. So that's why we really like appeals, and that's why we like to do the customer service part, where we can have that communication and talk through them problems. But it really does come down to the reappraisal. It's everybody's values is reset to what market value is. Now, that's the fun part. You got more than one person trying to understand what the property is on one property. And sometimes that takes that conversation to make sure we get to the right number. So, and that's why we leave all these avenues open to be able to do that.
Well, I guess this is just new to me. I just find it really difficult to stomach the fact that an industry, the real estate industry, is determining what properties are worth. I had envisioned that there was a way to reach that based off of what was fair instead of what you could sell it for, especially in this situation. I think looking at what you could sell for a year ago is a little more realistic than looking 2 months ago, because there are people buying property and never coming to Haywood County because they've got the money to buy it. I think that's going to go very poorly towards the people who live here and are trying to live here if we base it off of what we're under right now. And you're probably too far into it right now to back up and look at a year ago. But I would rather see the values from then, because that's closer to what Haywood County looked like instead of this virus. Because until the virus came along, I think it was a little more reasonable than what you were showing just a few minutes ago, because people are willing to pay this right now to get out of New York, Florida, all these places, Texas, where they're making a lot of money. They're willing to pay any price to get out of those areas because that's where the virus is at the worst.
Yeah, well, you know what we're doing, we're in the analyzing stage. We're still finishing the field part, but we in the analysis stage now. You know, we have them conversations all the time about where we at, but you know, then we have to deal with statutes as well, and the North Carolina General Statutes kind of dictate what we have to do. Sometimes it's not so much easy as, well, we'd like to do this, not when the statutes tell us we have to do that. And then if you don't follow these statutes, there's some things, repercussions from that Haywood certainly wouldn't want to get into. So.
Yeah, we're bound by the statute, and if we have to do a reval this year because our values are higher. Isn't that right, Bryant? Then, or I guess you guys could tell me, our values are higher than 20%, maybe, or isn't there a number that kicks that?
Yeah, 15%. If it's greater than
15? Okay. So go ahead.
You're exactly right. Excuse me. We actually got a notice from the state before COVID that our values to sales price was below that threshold. And so we were already in the reval process, and that was before March of 2020. So,
well, and that's my only issue with it, is if we're penalizing people that live here now based off of what this virus has done to us, we're not doing justice to those people. And the general statute, I'd love to know which one it is, because I'd be glad to look into that and see if I couldn't get some kind of something that would address this particular situation, because nobody knew this was coming when we started this. But I don't think it's going to be fair, because 3 years from now, these people are going to be stuck with these values, and now they won't be able to give their property away because this will be done.
That happened in 26, then 2011 hit, and that's what happened. We had high values in 06. 2011 happened, we went way down. And then 2017 happened, we went down a little bit more. And now it's 2021, and they're going to, kind of come back up.
Right.
So, but I've always said, real estate in Haywood County is a good investment, because we only went down in 2011 2%. In 2017, we only went down 2%. There was counties, I think Harrison County went down 10%. Cherokee County went down 30%, 30%. So but Haywood County has always been a good real estate investment, and we only had 2%, decrease. So, but I think this time we're going to reap those low values. It's just the economic reality of it. It's just the statute says you got to have fair market value.
Right.
And they're saying we have to do a reval now. And so we're kind of stuck.
Going forward, if there's concerns of, if the economy collapses and things fall, you're on a 4-year cycle. I mean, if the commissioners had that concern later on and the economy crashed, you could do a reappraisal the next year. You don't have to wait for it. So there is tools to address issues once you see there's an issue. I mean, but that would be something that y'all would need to decide on and do. I mean, the only thing we can do is what the statute tells we have to do, and try to do that the best we can and make sense of it. And, the good thing is we do have a lot of sales to be able to demonstrate it. But, here, and when you look at it kind of like a resort property, where you've got a lot of people from the outside that's buying these properties is generally around the general area, and it's in them pockets where them values may go up pretty like, but not out into other parts. So, I mean, you know, that's part of looking at this thing as a whole. It's not every property doing the same thing. You know, so just so somebody come in and bought this property for me, it doesn't mean everything else is going to that. So, you know, we have to make sense of it.
Well, I'd have to disagree. If you use the snapshot of right now, it really doesn't matter what you have for sale. You're going to get more than what anybody else around here would pay for it just because these people are coming here.
Yeah,
I just think you should use the snapshot of what we look like in 2019 instead of this virus time, because the virus time is really what's driving this.
Yeah.
And I won't be here. I mean, you guys will have to be the one to make these hard decisions. I just think that from an insurance perspective and figuring out what things are worth, because if your house goes to the ground today, we got to build you one back. I'm not building one for Beverly Hanks. I'm building yours back.
Right.
And I think that's the fair way to treat the people in Haywood County. I know you may be stuck with what you're doing, but if there's a way that this needs to be addressed, the statute that you're talking about, I would love to know what that is and start some conversation, because this is going to affect more than Haywood County. This is not just going to be us. Anybody that's doing an active reevaluation that are using these prices right now, there's going to be a problem with it, because I bet you couldn't give property away in Raleigh right now.
I just briefly talked with Jimmy about some counties, you know, not that far away that are losing value, and yeah, we're sort of, I don't want to say unique, but the growth we have is in values is pretty. What you saw from the comps that he was showing, it's pretty drastic. But keep in mind, the values is only part of the equation. Also, you can actually adjust the tax rate. So people are likely to see increases in value, but we'll probably do some work on the tax rate when we get a number. So what people realize in property tax may not be nearly to the level that they see an increase in value.
Well, that's one thing I've learned over the years of fooling with cattle. When you take one to the market, it brings market price on that day. And it is what it is. It's just like Bryant said, some parts of the country are suffering just the opposite effect. And it's not just the virus. I know a property that I'm very familiar with. A lady moved here from Seattle, Washington, all the way here to Haywood County, her and her husband. And she said she'd never been so glad to get out of that place in all her life, feared for her life. And it had nothing to do with the virus. So some of these people are getting away from other things besides the virus, and it could change. And there is a mechanism to change that. So, and by the way, Mr. Pless, I've talked to several people who really like to see their investment appreciate. You know, there are residents out there, and I understand your concern, and I appreciate that, but a lot of people like to see their investment go up. You know, they like to see their property go up. They don't like to lose money. And, you know, so there's two sides to the scales on that. And as Mr. Tanner and I think Mr. Moorhead has adequately explained, there is a mechanism in there to address a grievance, both as a resident and at the state level. So if we have to readdress that, I know you're going to Raleigh, but, you know, if we have to readdress that and do another revow to reflect, you know, drastic changes, I think we would all be willing to do that to protect the citizens of the county. I think I can speak for everybody in that. So, you know, there's always two sides to every coin. And, you know, I just want to throw that out there.
No, just a comment. I think the important thing here is the appeal process, and I think we're going to publish that. I'm sure it'll be on the website where we can do that, and people need to know if they have a concern or want to appeal, as long as they can bring some good evidence. That's the important piece there, I think. Just because, like you said, percentages may change, or just because you feel a certain way, but if you can bring some evidence, I know that your board, the committee's always been good about working with people, and I'm sure that'll continue on. So I think as long as they know how to appeal it, can bring the evidence, then we'll work with them to make sure the values are right.
Yeah. One of the avenues we did is implement an electronic process, which is the most convenient thing anybody could ever do.
If you don't care, speak into the mic. We can hear you a little bit, but I know some of these other people.
The electronic appeal process that we implemented for this reappraisal, that's the most convenient thing for taxpayers to do, and they can attach documents, appraisals, pictures, whatever they want to do. And like I say, that's the big thing. We encourage them, if they think they got a problem, to let us know where we can, try to address that. So one of the other things we did, we've already started working on a website basically for reappraisal, because we're going to put out there the information that they really need to provide us. So we're going to try to provide them with all the information they could ever need if they think they got an issue, other than just simply come talk to us as well. So.
Yeah, okay.
Dana's got some else.
Yeah.
Right.
Thank you.
Said I lost my mic, so sorry.
Any
probably a
other
good
questions?
thing.
No, that's a very good report.
Thank you.
One reason I'm here is
All right, thank you all.
because Mr. Kirkpatrick worked himself to death on these kind of things, and I can tell you that the values have increased tremendously across the board, that it is not just the virus. They're coming from all over. They're coming from Florida and South Carolina and Georgia, Alabama and Texas and California, Wisconsin. They come from the north to avoid the taxes. They come from the south to avoid the heat. Once we get the values, then we always adjust the tax rate, so we treat our citizens fairly. So it's not just based on the value, it's based on the tax rate. And in June, we'll take a look at that. We'll look at that rate, and we'll adjust it accordingly with our budget that our, hopefully, manager will choose wisely.
And you'll get a lump of coal if you don't choose wisely.
Okay, our next item under the agency reports is our introduction of new county employees. And we have, Brian, you want to do that? That's under attachment 7.
Thank you, Mr. Chairman. We have 4 new employees through the end of November in Health and Human Services. Joseph Herron and Julia Manning. In Development Services, we have Samantha Franklin and Zachary Reese.
Okay. Thank those folks for coming on board. Okay, our next order of business is our discussion or adjustment of the agenda. I do not have anything. Does anyone else at this time? Okay. We'll move on to our consent agenda. There are 10 items. Does anyone have any questions or comments about the consent agenda?
Just good to see some of that drug seizure funds put to good use for our law enforcement agency. Good to see that, get a little money from the bad guys and give it to the good guys. So.
Okay. Any other comments or questions? Hearing none, I'll entertain a motion. We approve the consent agenda.
So moved.
Is there a second?
Second.
Okay. Any other discussion? All those indicate by saying aye.
Aye.
Anyone opposed? Okay, that's unanimous. Okay, we'll move to our regular agenda. Our first item in the regular agenda is to request approval of a resolution honoring the retirement of Captain Chris Moody for 31 years of law enforcement service, awarding his issued badge and sidearm. We have our Chief Deputy, Jeff Haynes, here tonight, and that's under attachment 12. Welcome, Chief.
Good evening, Commissioners. Thank you for having us before you. What you have before you today is a resolution honoring the service of Captain Chris Moody in his retirement, and for the 33 years of credible service that he has given to Haywood County in several different respects. So with that, reading this resolution, it says, Whereas Captain Chris Moody joined the Haywood County Sheriff's Office in 1995 after serving from 1989 to 1995 with the Canton Police Department. Captain Moody held the ranks of Deputy Sheriff, Sergeant, Lieutenant, and Captain, all while serving within the Uniform Patrol Division and command staff of the Haywood County Sheriff's Office from 1995 until the 5th of November 2020. Whereas Captain Moody's service and dedication to the Haywood County Sheriff's Office and service and dedication and accomplishments in the field of law enforcement during his 33 years of total service are hereby recognized and commended. And whereas under North Carolina General Statute 20-187.2 provides that retiring officers of the Haywood County Sheriff's Office may receive at the sheriff's discretion an award to retiring officers the service sidearm of such retiring officer at a price determined by the Board of Commissioners at a price of $1, and upon securing a permit as required by North Carolina General Statute 14-402. Whereas Captain Chris Moody has served as a member of the Haywood County Sheriff's Office and is retiring from the Haywood County Sheriff's Office effective 5 November 2020, it is now therefore be it resolved by the Haywood County Board of Commissioners as follows. Sheriff Greg Christopher is hereby authorized in accordance with the provisions of North Carolina General Statute 20-187.2 to allow the transfer to Captain Chris Moody, the badge worn by him during his service with the Haywood County Sheriff's Office, and that Sheriff Greg Christopher is hereby authorized in accordance with the provisions of North Carolina General Statute 20-187.2 to allow the transfer to Captain Moody his service sidearm, which is a Glock Model 22, with the serial number recorded thereupon, upon the securing of a permit as required by general statute. Be it further resolved, the Haywood County Board of Commissioners recognizes and thanks Captain Chris Moody for his dedicated service to Haywood County and its citizens, adopted this 21st day of December, 2020. And with that, we ask for your acceptance of that resolution to honor him in his service.
I entertain a motion that we approve the request.
So moved.
Second. All those in favor indicate by saying aye. Aye. Okay, that's unanimous. Okay, thank you, and thank Captain Moody for his service. That's a long time.
Absolutely.
I would like to say that I've known Captain Moody a long time, a very, very long time. He's a good man, he was a good officer, and please tell him we commend him for his service and thank him for his service.
It'd be my pleasure.
I'd just like to add to that. I know Captain Moody for quite some time. I started at the Canton Police Department part-time in 1997, and he was working there at Canton PD at the time. We got to know him and his family, good family. I actually had 2 of his boys that have worked at my shop for me. 2 of his sons. I had to think about that for a second. And I've known Captain Moody for a long time, then worked with him some at the Sheriff's Department. But just like to thank him for his service and wish him a well-deserved retirement. Also got some war stories if anybody wants to know a few. So. Some's so good, some's so not.
Thank you, Brandon. Okay, our next order of business is to request approval of a new employee contract between Travis Cable and the Haywood County in the amount of $15,283 to be paid from fiscal year 2021 budgeted funds. And Chief Haynes, go ahead and cover that one.
Yes, before you once again, Commissioners, you have a contract for new employee for Travis Cable. Travis currently serves as a sergeant in our detention center. And we have started from a retention standpoint and also from an employment standpoint to make and secure that we're getting the best trained, qualified people. We were able to secure the ability through the Board of Commissioners to start contracting employees to go to basic law enforcement training, and then for the next 36 months thereafter, finishing their successful completion. We have succeeded with 2 of our employees so far that are currently working, and we have a second one that's in training right now, actually field training after they completed basic law enforcement training, and this seems to be very successful, and hopefully it will increase our ability to be competitive regionally as well too, and to help people to stay here. This is through budgeted funds, and it's in the value, this particular time while during his training would be just a little over $15,283 is what that cost is, and that is out of budgeted funds for this fiscal year.
Anybody have any questions for Chief Haynes? Okay, hearing none, I'll entertain a motion that we approve the second item of the regular agenda.
So moved.
Okay, is there a second?
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Okay, it's unanimous. Thank you, Chief.
Thank you very much.
Mr. Chairman, if I could make another comment directed, go ahead, David. With our law enforcement, this past weekend, we lost one of our retired deputies, Larry Golden, and just wanted to offer our condolences to him and his family, and let his family know that they're in our prayers.
I appreciate that, Brandon.
Very well said, yes. I knew Larry.
Yeah, that was a shock to me. Okay, our third item of the regular agenda is to request approval of a resolution to declare surplus personal property and authorize the disposal using private sale for vehicles and equipment within the Solid Waste Department. Our program administrator, David Francis, is here tonight, and that's under attachment 14. Welcome, David.
Good evening, Chairman, Commissioners, Santa, long time no see.
Of course, David.
Well,
Hopefully,
you know how
I'll
it
be
goes.
visiting you this year. It's been several years.
As well, it probably should. Before you, Commissioners, is some disposal of some old equipment at the White Oak landfill. Back in 2011, when we signed the original agreement with Santec, they also signed a 5-year lease of this equipment. In the first part of that lease, the first part of that contract, the Santec was working for the county. And then in May of 2014, we went to expanded management. But during that time, Santec started adding their own equipment down there. And this equipment became secondary. They started bringing on their own equipment as primary equipment. And as the age of this equipment got older and older, the less useful it became. Nothing in this list except for a 2007 truck. Most of everything else was purchased before 2005. And one of the things to be mindful about this equipment too, when Tommy buys a tractor, Chris buys a tractor, you expect a long life with that. But when you take that equipment down to landfill, you can cut all that life about in half, because the landfill runs 6 days a week, 10 plus hours at a time, and so the degradation of that equipment happens a lot sooner. As we said, we did lease the equipment. They did 5 years. We did 1 more year with them as well. Most of this equipment now has become parked and just needs to be disposed of. We went as well with where we purchased the equipment from originally, and asked about if it would be better, to wholesale this back, and they wanted to know how much we would pay them to get rid of the equipment. It's just a lot of age, a lot of wear and tear, and a lot of it is not operational any longer. So we're glad to take questions about the resolution, any questions that you all may have. General statutes allows the county and the commissioners to dispose of the surplus property, and also allows a procedure for private negotiation of the sale as well. But we're glad to take questions.
What's the year model of that Cat 725? Do you know, David?
The 725.
Off-road dump truck says it's operational.
Yes.
I don't see it listed.
I do. – 2005.
2009.
5.
Yeah.
I guess talking about fair value, I guess this is a fair value, David, in your opinion, for what we've got. I know a lot of it I see is scrap.
Yeah.
But
And because it's become unusable. We had a discussion here about it as well, too, about is there some equipment that we need that we could fix up, but it was just too costly for even us to fix it for something to be limited use as well. One of these pieces of equipment had a higher price of repairing it than what it was worth. Some of the parts now are obsolete, I guess would be the appropriate word to say.
Are we bound with that agreement with Santec to offer this equipment to them, or?
No, we were not.
Have they agreed to pay the 25?
Yes, sir.
I think your point is, should we look elsewhere maybe? Is that what you're saying?
I thought I was ready to vote on this today and let it go. Is this, looking it over, I got a little question. Have you had an appraisal on that Cat 725?
We had.
How many hours is on it?
I couldn't tell you that. I'd have to go back down there and, and get that information.
Do you know, Chris? Are they using it? Are they using it now? It says it's operational.
It is operational.
I tell you, the equipment that's at the landfill,
Yeah.
I don't think
Fired up.
it's pretty. It's in a pretty harsh environment when they're.
Yeah. This is the equipment.
Santa Claus.
You
need to bring them a new
Awful cold to
tractor.
me.
What is
Do you have a
the,
picture of the dump truck, David?
No, this is just the one picture we have for the two.
I mean, have you had anybody maybe make an assessment on that Cat 725 to even see what it was worth on the market if it's operational? Because the prices are all over the range. I Googled it, just, the prices on that model year.
Depending on the hours.
Yeah, depending on the hours and the condition. I mean, it's all over the map. Some of them up to $150,000 a piece. It's a huge dump truck.
Yeah, it's the big architect, yes, right. I'd be glad to go back and find everything out for you, but I think this is the fairest offer.
I just haven't. I don't know.
Well, it's not going to hurt us nothing. I mean, it's not like we're having to get rid of it right away, so maybe we could go back and see. I mean, it's...
Well, one of the things that we're with Santec is getting ready to be, the purchase by Republic's going to be taking place next month, apparently, and this is one of the things that we're trying to wrap up. If not, we may not be able, the Republic may not have the same offer that Santec had on this. This was a good faith arrangement from Santec.
I think.
How much longer is the contract with Santec?
Till 2030.
So Santec would have the ability to continue to use this dump truck till 2030?
It's parked right now.
But they would have it and be able to use it anyway.
Mm-hmm.
So if we take the 25, we're getting 25, and if we don't take it, they continue to use it and use it till it's worth nothing.
Yeah, like I said, it's being parked right now. It's operational. It's not being used.
David, I think we ought to take a little closer look at that. If you can stand to put it off a little while, it's just my opinion, but you got a picture of it, that 725?
No, sir, I did not make pictures of all the equipment.
Well, I mean, I just really can't vote on it, personally. I mean, I won't. I'm just one of five, but I mean, I've got a little question, so.
When's the contract? I mean, when are we swapping from Santec to Republic?
Sometime, they anticipate sometime next month.
Next month? Yeah, I agree. I say we put it off to at least our next meeting.
If we put it off to our next meeting, it's not going to be a deal breaker, right?
No, but...
Then there's no harm in waiting.
Yeah, it'll be at the second meeting in January. It won't be at the first.
Well, I never did like to be rushed to the marriage altar.
I'm sorry?
I never did like to be rushed to the marriage altar. I think we serving the citizens well just to take another
Well, I hope the first one took then.
You understand?
Sure.
I mean, what's y'all's pleasure?
Okay, yeah, we can wait, yeah.
But I'd like to, if you don't mind, let's talk after the meeting what the list that you'd like to have.
Yes.
With that, or we can go down there if you
We'll
want
go down
to.
there and look at it.
Okay.
Okay.
I'll be glad to.
Yeah, I'm here till Wednesday. I'm not here next week.
Santa might be able to ride us down there on his sleigh.
I don't know if I could
I've
listen
got
to
some
that
upgrades
accent.
to it.
We'll
Got
get
some
down.
upgrades.
We'll get down there.
We can get there quickly.
We'll take a look at it.
So is that a motion, I guess?
I would like to make a motion to lay that on the table to the next meeting.
Need a motion?
Lay it on the table to the next meeting, pick it
I'll
up.
second it.
You want to make a motion to table item number 3 of the regular agenda?
Should we table it or just discuss it next time?
Postpone it, lay it on the table. I'd like to pick it
I
up.
don't think we should table it.
Pick it up next time.
Let's just discuss it at the first meeting in January?
Same thing.
Okay.
Okay.
I just want to make sure we get the wording right.
Just put it on the agenda. We'll postpone it to the next meeting.
Okay. Is that, okay, so you made a motion and Brandon seconded it. Any other discussion? All in favor indicate by saying aye. Aye. It's unanimous, I believe. Anyone opposed? Okay.
Yeah.
A little legalese I'm a little concerned about, but that's okay. It'll probably work out all right. Let's move on to the next thing.
Okay, can I go to 4 now? Okay, item number 4, request approval of McGill contract in the amount of $37,000 to be paid from contingency funds for the purpose of updating the Haywood County Comprehensive System-Wide Parks and Recreation Master Plan. Approval of a budget amendment to allocate funds from contingency to cover said cost of master plan, and approval for the county manager to sign all documentation pertaining to said master plan. So, David, you want to do that one?
Thank you. Back in 2006, the Board of Commissioners authorized a comprehensive system-wide parks and recreation plan for Haywood County. 2007, this was presented to the board and all the other governmental entities in Haywood County about recreational and park needs in Haywood County. And with the county, started the recreation program back in 2000. And this was one of the documents that helped get the funding for Allens Creek Park. This has helped the county and the towns get other recreational opportunities and grants. When we were down in Raleigh in 2019, and we were presenting for the possibility of the Chestnut Mountain Park, we also went over to the North Carolina park folks, and we presented the Chestnut Mountain Park idea to them, and they were really in favor of it. So one of those things that they require and ask of us that we do is we have a master plan. And since ours is out of 10 years of age now, we need to update that master plan. And so this master plan allows us to go and receive these North Carolina Park and Trust recreation grants, rural trail grants as well too. So it's an important document because it helps us acquire grants for park and recreation. And it also gives the opportunity for the public, once we start this process, the public has a chance to have input. We'll have hearings, or if you want to call them that, surveys. It gives us a chance for that. So when we started working on this process after we got back from Raleigh last year, one of the things that we did, we submitted for 3 different companies to bid on this project. One was the people that had done this back in 2007, McGill Associates and Equinox. McGill Associates and Equinox both responded. Our Recreation Advisory Committee reviewed these proposals last year and recommended the McGill proposal to go back and update this master plan. And what the update of this master plan will really focus on is the turn that we are taking in the county. We're not going to focus so much on bricks and mortar, ball team, things like that. We're going to focus on the outdoor recreation aspect that where our county is really taken a stronghold into the recreation program with more things that we are Also going to be working on that, from Ian, if you remember, Ian spoke here back in September, talking about the participation level that we had with the hiking programs, with our fly fishing program. And we just recently completed a fly tying program. Next year, we're working on a water camp where kids will be able to learn to paddleboard, to kayak, and to fly fish at the time. So these things that are important, on getting grants for that. And then Chestnut Mountain, and with what we're trying to do out on the buffer property of the Francis Farm landfill, turning that into a bike park where children and families can go learn to ride mountain bikes. We'll have we're proposing 2 pump tracks, a bike skills course, and then a loop around the buffer. And so what helps with that is not paying it out of tax dollars, but using grant money like this as well. And one of the things that they mentioned in here as well that we'll be discussing upcoming in 2021 is how can the occupancy tax help us, complete programs like that. It was recommended back in then is for to be able to increase the occupancy tax to help pay for funding of recreation programs that both our citizens can enjoy and tourists can enjoy as well too. So it's a floating document that we have to be able to tap into these grants. As I said, the advisory board recommended this, and if you have any questions about this, I'll be glad to take those.
Do I have any questions for Dave?
Just one other note, I'm sorry. We had these funds budgeted last year, but we put this off due to COVID. And so they were in last year's budget. So I wanted to note that as well.
Anybody have any questions? Do you have any questions, Santa?
Oh, I'm very supportive of this. I'll move to approve it.
Is there a second?
I'll say.
Is there any discussion?
Well, in doing some research on this, I was talking to Bryant, and this is necessary for us, like David just said. I have a hard time hearing over here, David. Don't take it personal, but I don't know what it is about the sound over here. But I'm glad you don't have a mask on because I can read your lips. But I believe you did tell the people that it does qualify us for grants.
It does.
If we get a professional engineering group to do this study, at the state level, they recognize that as just pre-qualifying. So, there is a progression there. So,
you have to have an up-to-date master plan to be able to apply for the PARTIF grants, for the Rural Trails Program grants. If you do not have that, we can't even get into the door. Haywood County has not, taken a lot of advantage of the PARTIF over the years. We've only used about 1.3 million of those grants. And I think it's going to be very essential as we move forward with Chestnut Mountain, Francis Farm, talking about access on Pigeon, different aspects as we grow our recreational program. If we don't have this, then it's got to come straight out of the budget. Be mindful too that, this requires a matching grant, but we don't have to pay for all of it coming out of our county budget.
And I know we've talked about moving towards outdoor recreation, and that's a big part of this.
Yeah, really, proud of where, we've turned around. I mean, this next year I mentioned a couple of things. We're going to have a mountain bike program. Brandon serves on the Recreation Advisory Committee as well. And that's, we're going to be teaching mountain biking. We wrote a grant in 3 years ago. And I was able to go back and repurpose it a little bit to tailor for what we were needing here, and the folks that were the grant recipients thought that was a great idea. We've just recently purchased 5 bicycles, part of that grant, and we'll have our first mountain bike classes starting in the spring.
Is there other discussion? Okay, all those in favor indicate by saying aye.
Aye.
Okay. Anyone opposed? That's unanimous. Okay. Okay. Thank you, Dave.
Just one quick thing. Thank you very much. Appreciate all that you've done for me over the years. It's been, you know, I just can't believe, you know, we're here at this, but thank you so much. It's been, you know, we've had some laughs and we've spit at each other a time or two, but it's been worth it. And she's been very patient with me, and you know, and I really appreciate all that you did for me. Thank you.
Okay. The next item of the regular agenda, number 5, is to request approval of a special use permit for a wireless telecommunication tower application pursuant to Haywood County Code Ordinance Chapter 115, the wireless telecommunications facilities. And we have our Development Services Coordinator, Jody Davis, here tonight. Welcome, Jody. Thanks for hanging in there with us.
Thank you. Commissioners, I'm here tonight to request your approval for the wireless telecommunications tower at 520 Pigeon Valley Lane in the Silver Bluff area of the community. We had the public hearing back November 16th, and since then I had one other call about the tower, answered that person's questions, and haven't heard anything else from anyone in the public.
Does anybody have any questions on that? Okay, I'll entertain a motion that we approve item 5 of the regular agenda.
So moved.
Is there a second?
Second.
Any other discussion? All those in favor signify by saying aye. Aye. Okay, it's unanimous. Thank you, Jody.
Thank
Appreciate
you.
you staying.
Merry Christmas.
Okay, Merry Christmas.
Merry Christmas.
Okay, item number 6 is to request approval to accept and appropriate $705,968 from the North Carolina Department of Commerce for a grant and appropriate $75,000 from contingency fund to capital project for the required county match. Approval for county manager to execute all documentation to complete the grant requirements. Bryant, go ahead.
Thank you, Mr. Chairman. We've talked about this grant at length over several public hearings, and the good news is it was a successful grant. Not only did we get funds to upfit the armory, but we also got about $137,000 for mountain projects to help with rental assistance. So there's a lot of hard work. David, Will, folks in public health and social services, and we used McGill to help us. So a lot of work, but it paid off to get this $705,000. We have to put about $75,000 out of contingency with it to do some of the upfits, but it's a great savings to the county. We'll get the lead out of the armory and start renovations as soon as we get the actual check from the state.
Okay, great. Does anybody have any questions for Bryant? Okay, I'll entertain a motion that we approve item 6 of the regular agenda.
So moved.
Is there a second?
Second.
Okay, any other discussion? All those in favor indicate by saying aye.
Aye.
Okay, anyone opposed? It's unanimous. Okay, we'll move to item number 7, is to request approval of a resolution of the Board of Commissioners of Haywood County, North Carolina, approving an installment financing contract, a deed of trust, and other related documents for the Haywood Community College HHSA building project that also includes the nursing education program, and to pay in full the crafts education building project debt. Julie?
Good evening again. This resolution is what we call the approving resolution, and it is where you actually approve the bank that we have chosen and the interest rate, and you approve for the documents to be signed, the deed of trust, the installment contract, and all that kind of thing. We have a excellent interest rate. JP Morgan Chase Bank has the lowest bid. It was 1.59% for 15 years, so I thought that was a very good rate for this loan. And this is the one that's a little complicated. This is the one where we are rolling two things into one. We're borrowing $5 million for the project at the community college. It's a little over $7 million project, but they have a grant for that. So the $5 million is for the to actually work on the project, and the difference is what's left on the crafts building loan that was also for the community college. So we're refinancing that particular portion. It's about $3.8 million, and then with the $5 million, it brings the total up to, let's see, $8,391,000. So $8,391,000. $5 million is the community college new project, and the difference is the payoff of the crafts building loan. So now that I've got everybody confused, I'm sorry. But it is a little bit of a complicated loan because it is all rolled into one loan with one interest rate.
Okay. And I'm sure that's saving us money, right, Julie?
Yes, it did. In fact, the refunding saved us almost $120,000.
Wow.
Just in that
How much?
refunding
Just to
piece.
refinance.
How much did you say, Julie?
The refunding itself saved us almost $120,000
Okay.
over the rest of the term.
Good job.
You're paying attention, right, Chris?
And I will need you to approve the resolution separate from the budget amendments that are
Okay.
following.
Okay, so does anybody have any questions for Julie? Can I have a motion to approve item 7 of the regular agenda, just item 7?
So moved.
Second.
Okay, all in favor indicate by saying aye.
Aye.
Okay, you want to post? Okay. Then item A, 7A, is to request approval of a budget amendment for $5 million to appropriate the installment loan proceeds for the Haywood Community College HHSA building project costs. I also want to say that we have Dr. Shelley White here tonight. Thanks for hanging with us, Dr. White, for the meeting. Appreciate you being here tonight. Did you want to say anything?
Thank you. Thank you for having me. Thank you for considering this and supporting this project throughout the year. I just wanted to say also thank you to Julie for being an active partner throughout the year in our project moving this along, as well as Bryant. The county has been an active partner throughout the year with us and the Haywood Healthcare Foundation. We just so appreciate that. In a challenging year, when we've had to shift our meetings to in person and getting me up to speed in my new role. We've been meeting by Zoom on a monthly basis to stay connected and gone through the whole bidding process and the support from our board. They met week before last completely via Zoom to approve the bid moving forward. So just to know that this project has been supported by many partners, and we're very thankful to be moving forward and thankful for your support. This will positively impact the healthcare workforce in our area for generations to come, and we're very excited to see this project come to fruition. Thank you.
Okay, thank you, Dr. White. Okay. Okay, then this is 7A. Sorry about that, Julie. I should have done that to start with.
Oh, no, that's wonderful. I'm going ahead and doing the budget amendment for this, so as soon as we close the loan in January, we can start paying off some of the closing costs and be ready to start funding this project. So this first one is for the $5 million. That's for the project. This is in a capital project loan, and it's broken down according to the budget that the college had given us.
Okay. Okay, so I'll entertain a motion that we approve item 7A.
So moved.
Second.
Okay, is there any other discussion? I probably should ask that to start with. Okay, all those in favor indicate by saying aye. Aye. Okay, anyone opposed? Okay, that's unanimous. Okay, then the next item is 7B, is to request approval of budget amendment for debt service of principal of $3,391,000 to appropriate the refunding proceeds to pay off the old debt for the Crafts Education Building project in order to allow the property to be used as collateral for the new loan. Okay, Julie?
And this is one of those accounting functions where in order to pay off the loan, we have to show it as an expense. And then, of course, we have the offset of the loan proceeds that are coming in to cover that. So it's a net zero, really, to the general fund, but we do have to show that. So there's the $3,391,000 that is going to be paying off this loan, and we do have a budgeted an amount of this loan to pay for this fiscal year. So I think the loan payoff is probably a little closer to $4 million, but part of it we already have budgeted. So this is the part that we didn't have budgeted to refund the loan.
Okay. Does anybody have any questions for Julie on that? Okay, I'll entertain a motion. We approve item 7B.
So moved.
Is there a second?
Second.
Okay, any other discussion? Okay, all those in favor indicate by saying aye. Aye. Is anyone opposed? That's unanimous. Okay, thank you, Julie.
Thank you.
Appreciate it, Julie. And tell Ed we appreciate him allowing you to work here, and I know he's going to enjoy. Hopefully, you guys will have some good time. Okay, yeah.
I would like to say I appreciate Ms. White being here also, Dr. White. This was a project, we discussed at length some time back, and it was pretty easy for us to go, but it was helping our, education, workforce development, and our medical field, and so it's a win-win-win, and we really appreciate all the work you're doing at the community college with our workforce development. And I know you got close ties to AB Tech, and they landed a big one with Pratt & Whitney. I know they're working closely with that facility to do workforce development for that. And, I've got a good friend that told me that about 1,000 good-paying jobs here in Haywood County would cure a lot of our ills. And so we look forward to that day when we can do a project for our county through your facility there at Haywood Community College and elevate our county on up another notch or two. So thank you for the work you're doing.
Okay, we'll move to our next order of business is appointments, and I'll turn it over to Bryant for the appointments. Thank you, Bryant.
Thank you, Mr. Chairman. Item number one, there are currently 4 TDA seats that need to be appointed. The recommendation is to reappoint Gail Moll. She'll be serving the Canton municipal seat. John Feichter will be appointed to a full term. He's currently serving the spot that's vacated when Amy Owens left. And Tammy White, she'll be representing the TDA with hotel, motel for 20 units or less. And then Chris Corbin, 20 units or more. I think Lynn Collins is here if she has anything to add to.
Did you want to say anything, Lynn? No? Okay. Okay. Okay, so I'll entertain a motion that we approve item 1 of the appointments.
So moved.
Okay, is there a second?
Second.
Okay. All those in favor indicate by saying aye.
Aye.
Okay, that's unanimous. Okay, number 2, Bryant?
This is to replace the appointment of Lyndon Lowe to the 1% subcommittee with Dave Angel. Mr. Angel is from Elevated Mountain Distillery, and his term will run through the end of December 2021.
Okay. I'll entertain a motion that we approve item 2 of the appointments.
So moved.
Is there a second?
Second.
Okay, all those in favor indicate by saying aye. Aye. Okay, it's unanimous. Okay, the next one, Brian?
The last one, Mr. Chairman, is to reappoint Robert Dolman to the Town of Clyde Planning Board. I got an email from Joy Garland who asked for the Clyde Board of Aldermen requests the reappointment. They say the removal of Mr. Dolman would be detrimental to the functions of the Clyde Planning Board.
Okay, so I'll entertain a motion for item 3 of appointments.
So moved.
Is there a second?
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Okay, that's unanimous. Okay, our next order of business is a closed session, economic development, 143-318.11A4. I'll entertain a motion. We go into closed session.
So moved.
Okay, is there a second?
Second.
Okay, all those in favor indicate by saying aye.
Aye.
Aye. Okay. And we'll be in closed session when we enter the chambers in the back. And it'll probably take us about 20 minutes, maybe. He's doing that, so. Then, once we come back from closed session, we'll complete the rest of the
He'll find you.
Does that mean he's rolling?
Got to come back from closed session.
I guess I can go ahead. Okay, we've returned from closed session, and Mark, you wanted to make a statement?
Yeah, I'm just going to say I appreciate it, guys. I really enjoyed it. Sometimes it's been entertaining. Sometimes it's been very serious, but I think we've got a lot of stuff done for the county. I think we've done a lot of things that are in the best interest of the people, and I have enjoyed sitting up here with each and every one of you and the times that we've been able to sit down and make decisions together and do things, and I'm going to resign effective immediately so that they can appoint my replacement.
Okay. All right, Mark, before you leave. I've got a plaque for you, and we want to thank you, recognize you, and thank you for your 2 years of service to the citizens of Haywood County. And we appreciate your service and all that you've done. I could have taken it out. That's what I should have done.
Thank you, Mark.
Okay, and at this time, according to the statute, the county, the Republican Party, which Mark is a member and was elected, will be required to name a replacement. And we have Kay Miller, our party chair, here tonight to do that. Okay, come on up.
Thank you, Chairman Inslee. Vice Chairman Rogers, Commissioners Patrick and Long. The letter reads, Dear Chairman Inslee, on behalf of the Haywood County Republican Party Executive Committee, and in accordance with North Carolina Statute 153A-27.1, I am honored to recommend the appointment of Mrs. Jennifer Best to the Haywood County Board of Commissioners. Many excellent candidates were vetted across several weeks in public forums and personal interviews. Our executive committee determined that Mrs. Best had the mix of skills and abilities that were most fitting to serve all the people of Haywood County. Having been notified just now that Commissioner Mark Pless has tendered his resignation as Haywood County Commissioner effective Monday, December 21st, 2020, I hereby submit our recommendation within the 30 days of the said vacancy in accordance with the North Carolina Statute 153A-27.1. Sincerely, Kay Miller. Thank you.
Thank you.
Okay, thank you, Kay. And then if Ms. Best will come up, we'll, in your family.
Vote on it, don't we? Vote on it? Vote on it.
Okay.
We have to vote on it.
I need a motion that we accept Mark's resignation.
I'll make that motion.
Okay.
Second.
Okay. All those in favor indicate by saying aye.
Aye.
Okay. Do we need a motion? Okay. Then I need a motion that we appoint Jennifer.
I make a motion that we accept the recommendation of the Haywood Republican Party and accept their recommendation for Jennifer Best to replace Mark Pless.
And I will second that.
Okay. All those in favor say aye.
Aye.
Okay. That's unanimous. Okay, Jen, come on. Stand right here. You'll stand right here. I think that's what Ryan told me. Okay. And then, okay, welcome, Jennifer. And then you want to introduce your family?
This is my husband,
Okay, Daniel.
and our son,
Okay, Chance. We appreciate y'all staying with us, Chance. I'm sure you'd rather be doing some other things. He's probably saying, this is the boringest thing. I don't know what my mom's doing.
Our meetings are usually a whole lot longer than this, right?
It's going to really good. Okay. Okay, then if you want Daniel to hold your Bible. If you, yeah. And then please see your right hand on the Bible. Is that it? Right hand on the Bible and raise your left hand. Okay. Okay. Okay, I, and state your name. Okay, do solemnly swear or affirm that I will support and maintain the Constitution and laws of the United States and the Constitution and laws of North Carolina, not inconsistent therewith, and that I will faithfully discharge the duties of my office as Haywood County Commissioner, so help me God. I will. Okay. I, state your name. I, Jennifer M. Best. Do solemnly and sincerely swear that I will support the Constitution of the United States, that I will be faithful and bear true allegiance to the state of North Carolina and to the constitutional powers and authorities which are or may be established for the government thereof, and that I will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States, to the best of my knowledge and ability, so help me God. I will. Okay. I, state your name. Jennifer M. Best. Okay. Do swear or affirm that I will well and truly execute the duties of the office of Haywood County Commissioner according to the best of my skill and ability, according to law, so help me God. I will. Okay. All right. Thank you. Okay, I've got something for you to sign, so hang on just a second. Sign it here. All right, now you're a commissioner. Okay. All right, if you would just go ahead and take your seat. Yeah. Okay, welcome, Jennifer. Okay. Okay, our next order of business under the organizational session is to for the commissioners on which the boards that they'll be serving and considering assignments. And I've spoken to each of you about these boards. Is there anyone who'd like to make a comment on that?
I don't think so. I think I'm comfortable with what I've got, and I think everybody else is as well.
You okay, Kirk?
Santa Claus is shaking his head, yeah.
Okay.
I'll have to ask him. I think he'll continue to serve. Boards.
Okay. Yeah, Santa Claus is going to have to ask Kirk. Okay, should I read these? Okay.
Yeah, might not
You want me
hurt.
to read them? Okay, I'll just go on. A lot of people think a commissioner is you just show up for these meetings twice a month, and it's a lot more than that. There are 29 boards that you serve on. For instance, the Commission for a Clean County meets the first Thursday at 4 p.m., and Commissioner Long is on that board. The Downtown Waynesville Association meets the fourth Tuesday on May, September, and the time is to be determined. Commissioner Kirkpatrick serves on that one. The Engineering Review Board will be, Commissioner Best now, will be serving on that. The Fairgrounds Board meets once a month, and Commissioner Long serves on that one. The French Broad Metropolitan Planning Organization, Transportation Advisory Committee, I serve on that. That meets once a month. And then there's the French Broad River RPO, which is a rural planning organization. I serve on that. That's once a month. Haywood County Advancement Foundation, I serve on that. Haywood Chamber and Economic Development Council, Kirk serves on that committee. The Haywood Regional Medical Center Hospital Authority, which is the fourth Thursday, Commissioner Kirkpatrick serves on that committee. Haywood Health and Human Services Agency Board, Commissioner Rogers. The Juvenile Crime Prevention Council, Commissioner Best will serve on that. The Local Emergency Planning Committee will be Commissioner Rogers. The Library Board of Trustees is Commissioner Kirkpatrick. The Mountain Projects Board of Directors, Commissioner Rogers serves on that committee. The Recreation Advisory Board, Commissioner Rogers serves on. The Sediment Control Commission, Commissioner Best will serve on that. The Southwest Commission I'm the appointee to serve on that, but any of the commissioners can attend those meetings. So Jennifer, if you want to go to those, Commissioner Long attends those. That's really for all elected officials. They meet, well, when COVID's not happening, they meet once a month. Or they meet bi-monthly, and they usually have a dinner at that at that meeting, and it's the 7 western counties meet for that. We usually meet over in Cherokee. So if you'd like to come to that, it's really good. The VIA Advisory Board, Commissioner Best will serve on that board. And the Solid Waste Advisory Committee, Commissioners Rogers and Long serve on that one. Tourism Development Authority is served by Commissioner Kirkpatrick, and the Watershed Review Board will be Commissioner Long. So those are the boards that you serve on, other than this board. So I just kind of give everybody an education of what all commissioners do. And then there's other boards that we serve on in our community. So does anybody have any comments?
Just one last comment, and I'll do this for Santa Claus. I'd like to wish everybody a Merry Christmas and remember why we celebrate the season. You know, a lot of times it ain't all about the gifts and how much money we spend on one another, but it's about having family together and enjoying that quality time and remembering the true reason for the season. So Merry Christmas.
Okay.
I'd like to echo what Commissioner Rogers just said and tell Mr. Pless it's been a pleasure serving with you, and good luck in Raleigh. And remember us when we come, you know, with our hand out, want some help, and don't send any unfunded mandates down here, okay? If you want to mandate something, send money with it. And it's a pleasure to have Ms. Best join our board. And as Mr. Rogers said, Merry Christmas. Remember what the season is about, the Christ child, and we celebrate the hope that we have in him. And so I say Merry Christmas to all.
Okay. And Jennifer, I'm sorry, I should have asked you if you wanted to say something besides this, but did you?
That's fine.
Okay.
I'd like to thank y'all for the opportunity, especially the Republican Party, for the opportunity to be here. I'm looking forward to serving the community and hopefully serving it very well. I'm excited for the opportunity to sit with Santa on my first meeting here. Congratulations to Mark for his step up at the state level. And again, I want to say thank you. I am reminded of the Bible verse that says, "But for the grace of God go I." So I'm thankful that I have the opportunity to serve here tonight, and wish everybody a Merry Christmas.
Santa. Well, let me just say before I turn it over to Santa that Commissioner Pless, I appreciate your service on the board, and we look forward to working with you from Raleigh. And I'm sure Becky, I should have said something. Becky's back there tonight with Mark. I think she'll keep him straight. Yeah. So he'll be in Raleigh now, Becky. So, but Mark, we appreciate your service on the board, and you know, you came in with it was kind of historic because you came in. And Tommy came in, and we had a Republican majority, and now that Jennifer is now the first woman Republican to serve as a commissioner. So we made a little bit of history tonight on the board, and we appreciate her service. She's the third woman to serve as a Haywood County commissioner. I think I remember the last time we had an appointment was, I believe, back in the mid-'90s. It was, I believe, Jack Rice out of the community, Bethel community, Beaver Dam community. Served as a commissioner. He was appointed as a commissioner to fulfill an office that was vacated. So that's been almost 25 years ago, probably that happened. So a little bit of history being made tonight. So, but this was for a good reason. Mark got elected to another office, to a higher office. So. But and I want to wish everyone a happy Christmas. At my driveway, I say there's a sign up that my wife and I put up. It says Jesus is the reason for the season. I pray that everybody remembers that. And with that, Santa, you want to get us some good words?
All I have to say, Kevin, is you better watch out. You better not cry. You better not pout. I'm telling you why. Santa Claus is coming to town. He sees you when you're sleeping. He knows when
I make
you're
a motion we
awake.
adjourn.
He knows when you've been bad or good. So be good for goodness sake. Oh, you better watch out. You better not cry. You better not pout. I'm telling you why. Santa Claus is coming to town. We wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year. So moved.
Is there a second?
Second.
This is to adjourn, right?
Nope, this is the board.
What was that for?
Boards.
For the boards.
Sorry.
Messed up my.
All in favor indicate by saying aye.
Aye.
Aye. Okay. You just kind of put
really
cold water on the Santa. You're going to get cold.
Ho, ho, ho. 6 commissioners.
I'll entertain a motion. We adjourn.
So moved.
Okay, is there a second?
Second.
Okay, all in favor indicate by saying aye.
Aye.
Okay, we're adjourned. Thank y'all, and everybody be safe out there.